We will continue today to do the pathophysiology review, diseases. And also I want to remind you, according to the syllabus schedule, we will have which is the first simulating exam. So next week, I'm going to give you a simulating exam, which has 100 questions, just like a pretending is a board exam. So you're going to do it. I will give you 2 hours to finish it. And after you finish it, and I will spend the last hour to quickly go over those questions with you. Okay. And the exam is going to be online. So next week at 9 o'clock, you log in and you can see the question and then the answer sheet over there. And you can just answer those questions and then send me your answer sheet once you're done in 2 hours. Okay. And after that, we'll quickly review it, and give you the answer keys for next week. Okay. So it's kind of like a practice exam because we've been here. This is the 5th week already, right? The 5th week. So we want to see how you should improve somehow, especially the ones we have already reviewed, right? Okay, so last time we finished the Giardia, number 83 here. Now, I mentioned that Giardia is a parasite infection. This infection usually is from contaminated water. Okay, so drinking contaminated water. Let's say some people live in the countryside, and they use the well water, they dig a well, and they use this water, which is not boiled, and then you may have a Giardia. And it causes diarrhea. Okay, and most of the time it's self-limiting. It's not something very serious, but still. One time on a national board exam, they asked this question: what is the most common parasitic infection in the United States? And the answer is Giardia. Yeah, so this is number one. Parasite. So parasite in US overall is not very common, right? But Giardia is the one, if it happens, parasites. Giardia is number one, okay? And the contaminated water, you have to remember. Now, 84, malaria. Malaria, you just have to know is what? Is from the mosquito bite. Yeah, but mosquito does not cause disease. It just transmit the pathogen, which is also a parasite. Yeah, it's a single cell parasite we call protozoa. Yeah, malaria. Okay, so but mosquito bite is just transmit this pathogen. Okay, and then malaria is actually the feature is what is chills and fever, right? Alternating, and so that's why TCM sometimes people want to associate. If a person has intermittent chills and a fever, right? And what kind of syndrome is that pattern? We'll call what? Half inside, half outside, Yeah, half and a half is what? Salt. Shaoyang, yes. Shaoyang syndrome, right? Half and a half, intermittent. So that's actually particularly applied to malaria. We know that, okay? I think on a national board, usually we don't see this question. If they ask, they probably will ask you the transmission vector, which is mosquito. And then HIV infection and AIDS. Yeah, this is actually could happen on exam quite often. You know why? Because 2 blood-borne pathogens, yeah, and which has impact on healthcare workers, including acupuncturists. One is hepatitis B. Another one is HIV. And hepatitis B, we don't worry about too much because we all get a vaccine, right? And to prevent that. But HIV, we don't have a vaccine. So that's why I have to be very cautious. But overall, the chance to get HIV is very low. First, the patient has to be HIV positive. And even though positive, you have a needle stick, and then your chances to get HIV is only like a 0.5 to 1%, 0.5 to 1%, okay? So HIV virus and the human immunodeficiency virus. Yeah, but the thing is, HIV, how do you actually confirm a person has HIV infection? So you confirm the exposure to the virus. Well, basically is do antibody tests, antibody against HIV, okay? But then if untreated, somebody got an HIV positive, not getting a treatment or refuse to have a treatment, then you're going to probably wait about 10 to 15 years. And it will develop into the what? AIDS. Okay, AIDS is acquired immunodeficiency syndrome. But AIDS diagnosis is not based on antibody, because antibody is already, we know, is for the HIV infection. AIDS diagnosis is based on what? It's on a T cell count. T cell. Why T cell count? Because this virus, HIV virus, the target is the T lymphocytes. So when they bind to T lymphocytes, kill T lymphocytes, and the T lymphocyte number keep dropping and dropping, and to one level, and then we diagnose what? AIDS. Then when the T cell level is very low, eventually what? A person's immune system totally what? Compromised. Okay, compromised. Yeah. Yeah. Oh, the needle stick with HIV is 0.5 to 1%. I think that was the CNT question. Yeah, but sometimes on a board exam too. Yeah. So if a patient HIV positive and you're treating this patient, and the same needle insert to the patient, and then also what? You have a needle stick on your own fingers, and then the chance you have HIV is 0.5 to 1%. That's why you need to follow up with the doctor. They have a protocol. Yeah.
Could you repeat that AIDS diagnosed by T cell, that part?
The part, because T cells is actually what get mature in the thymus. So thymus is when you were young, you will have thymus, right? Thymosin, the hormone, promotes the T cell maturation. But then with age, so usually after 20 person, and the thymus gland gradually decline, degenerate. So that means you don't even have a place to get more T cells. So when HIV virus attacks the T cells, so they're gonna gradually kill what? T cells. But why they particularly attack T cells? Because T cells has HIV virus receptors. So they're easily for HIV virus to attach to them, and then they damage them. And then that's why we're waiting when the T cell level drop. Well, actually clinically it's dropped to 200 per units. So then we diagnose AIDS. But you don't have to remember the value, the lab test. Just say T cell count drop to a certain level. That's what we give a diagnosis for AIDS. And then when AIDS happening is what? It's the all immune system compromised, right? And that person easy to get an infection, easy to get a cancer. Okay, so that's what the concept you have to know. Okay, an average, right, from HIV initial to AIDS used to be 10. Now they say it could be a little longer, maybe 15. 10 to 15 years. Okay, so that period from HIV initial infection to the final full-blown AIDS. Okay. Then number 86, seems like this one occurs on board exam quite a lot. Infectious mononucleosis, or a lot of time we just call mono. It's a very common infectious disease in the college student. So that's why there's a name called kissing disease. Why they call kissing disease? Because this virus, well, first you have to know what's the name of virus. It's Epstein-Barr virus, EBV. This virus is transmitted through saliva. In the saliva. So when you kiss someone, you have a saliva exchange, then you know what? You may get it. Mono. Okay? And mono, the features you have to know, right? Lymph nodes, cervical lymph nodes enlarged. That's my feature, right? Sore throat, and also very tired, fatigue. And there's no particular treatment. Mostly it's just a what? A rest. Rest. But be careful. Few, not a lot. Kind of a rare complication. Sometimes the person's spleen is enlarged. When spleen is enlarged, you should avoid any contact sports activity, because when you have a contact sports activity, the spleen rupture, the internal bleeding, and you're gone. Okay, so that's the only concern. So it is actually the virus infection through kissing. Okay, so that's for mono, infectious mononucleosis. Okay, very common. Usually the case study, they will say a college student presents to the clinic with fatigue, sore throat, right? Maybe some runny nose, and then upon physical examination, cervical nodes, lymph nodes enlarged. Is that right? And what is the most likely diagnosis? Something like that. And then you know it's mono. College student. Okay, and it has those kind of cold-like symptoms, but particularly lymph nodes, cervical lymph nodes enlarged.
Does it have vaccine?
Huh?
Vaccine.
No vaccine. This one has no vaccine. No vaccine to prevent that. Okay? So that's 86.
So it will recover by itself?
Normally self-limiting, usually. But you need to rest. You cannot just have lots of activities. Okay? 87, flu. Flu, we know that. Influenza. viral infection, right? Which is actually what? It's a virus. Yeah, but flu can be prevented by a vaccine, or at least reduce the opportunity or risk of flu. But here's the question. Yeah, they ask, why you need to get a flu shot every year? Well, other vaccine, you maybe get it once, right? Or like a hepatitis, you get 3 dosage, that's it. But why flu you get every year? So this you have to know, because flu viruses change every year. Change, okay? And this change is kind of interesting. A little change they call shift. A big change is called drift. Shift and a drift. So every year you have different strains of flu viruses. I mean, you have to, based on those particular strains, and they develop what? The vaccine. Okay, yeah, to help you, huh? What's that?
Every year it has different.
Every year they have change, yeah. A small change is called shift, a shift, gene shift, the genetic shifting, and the other one big is called drift, yeah. So that's why it's well, basically it's just the viral genetic material keep changing, right? So if you last year you get a flu, may not be good for this year prevention. So every year you have to get a newer one. Okay, yeah. So just genetic changes, basically just genetic changes. Yeah. Okay, that's a flu. And then measles. Yeah, see the next 3: measles, mumps, rubella. Measles, skin rash. Mumps is enlarged salivary glands, right? Rubella is also skin rash. Those 3 you have to know is what is the infectious disease commonly seen in children, and we like to use a vaccine. It's a triple antiviral vaccine. It's called MMR. So those 3 vaccines are combined, okay, against that. Now, these 3 vaccines together, we give to a child. Before, a long time ago, I remember was starting at a 6 month. They give to baby. Now all delayed till 12 months. Even Texas, I believe, 15 months. So at least 12 months old. Why? There's a reason. Because those viruses, the vaccine, are live virus, live. So if it's too young, and sometimes it could be a little dangerous to the baby. But when they reach 12 months, or 15 months, then what? Their body's immune system more mature, so they can handle it. Yeah, that's why we delay now till 12 to 15 months for measles, mumps, rubella. Actually, also those MMR triple vaccine, plus a lot of times the vaccine you do together, well, with the chickenpox vaccine, same thing at a 12 to 15 months, which is another live vaccine, live vaccine. Okay.
So to wait for the baby to have enough
immune
antibody.
No. Well, if it gave too early,
Yeah.
the baby's immune system is not mature yet. They may not be able to respond. You have to wait at least 1 year old, 12 months. Then you can actually immune system can make a response, generating antibodies. Mm-hmm. So that's what they notice.
Well, some of my friends, they complain, they consider maybe this is the reason that many kids has
autism. Yeah, could be, but not actually many. 1 out of 1 million, maybe, get autism. Mm-hmm. So just like the chance, I remember one time a doctor said, this is the chance you get a vaccine and you get autism, just like a chance you take a plane crash, you die. Mm-hmm. Same thing, so is that right? But you cannot blame on the airplane because the chance is very low, but it's possible. Sometimes, you know why? So your body's system maybe overreact. Yeah, and there's no way you can detect this before you do vaccine. Yeah, it's very hard to detect. Yeah. But there's definitely some association, yeah, but not all of them. If all of them, the vaccine is not going to be on the market anymore, right?
Why do we have this vaccine? How about 3 years or 5 years later?
Well, that baby get a disease already.
Is it serious?
Yeah, measles generally is a rash, but it could be serious, like affect the brain. Patient could die. So that's why infectious. Yeah, and it's very susceptible to those. So usually with the chickenpox, but remember, chickenpox, if you get a chickenpox, you survive, you only have one time. You get a permanent, lifelong vaccine. But unfortunately, chickenpox virus and the shingles virus, same virus. So that's the problem. So you get chickenpox, you survive, right? Then you're not going to get another chickenpox the rest of your life. But because chickenpox, shingles, same virus, so you may still get shingles. So when you grow older, even though you have a chickenpox when you were young, and then you're not going to have a chicken pox, but you're going to still have a chance to get a shingles. So that's why adult. Now I think the standard is 50 years old or older adults should get what? Shingles vaccine. Shingles.
So I wonder, chickenpox, it might occur when someone has the immune system goes down.
Yeah.
Right.
Yeah.
So can we call this
Opportunistic.
opportunistic?
Yes, yeah. Opportunity. Like an HIV patient, AIDS patient, right? Supposedly a lot of diseases shouldn't get it, but because immune system compromised, they get anything possible. Yeah, some diseases like a normal person can never get it, but they will get it. Yeah, that's the problem, weaken the immune system. Okay, so shingles, you have to know that same virus as chickenpox, but shingles, this virus, what's very tough. They're hiding the nerve root. When something activates them, you know what? They come out along the sensory nerve. That's why shingles, the main thing is not even rash. Rash just a little bit local, automatically resolve in a week. But the problem is what is pain. Shingles can cause severe pain. I tell you, I see the real case. Somebody has shingles because they cannot handle the pain all the time. You know what happened? Commit suicide. I don't want to deal with this anymore. Commit suicide. Kill himself. That's, you can tell how bad it is. Yeah, so shingles, sometimes it's just after. Yeah, this rash is a little bit. Yeah, so but the pain, lasts forever, Yeah, sometimes even need the surgery. Doctors have to pull the nerve root out, take the nerve out. So don't let them spread the virus spread through the nerves, okay? So shingles, you need the vaccine. 2 dosage, 50 years old. You need to get shingles. It doesn't matter you have chickenpox before or you don't have chickenpox, doesn't matter, but still get a shingles. But shingles vaccine, there's a problem. What problem? I've experienced vaccine. 2 dosage, extremely strong reaction, especially first dosage. After you get a shingles, you know what happened? A few days, you got some fever, and the injection site is very painful, and you feel exhausted, even though there's no shingles, but kind of a reaction, body's reaction is pretty strong. Yeah, and I was young, I had a chickenpox, so I never had a chickenpox vaccine. Yeah, but when I get a shingles vaccine, oh my God, the first one was really bad. Yeah, first one. I had it, a few years ago, so yeah, it was already delayed, but still 2 dosage to avoid shingles, okay? You don't want to have something happen later, So that's virus, so we remember. Now, 93, poliomyelitis. Well, this is the virus not as common as before. Polio used to be what is the most common crippling disease. What's crippling? So a person the leg is affected, motor, right? And it cannot walk, cannot be stable. And then it's a polio virus. Because polio virus affects what? Affects the spinal cord, especially the motor area, motor neuron area, motor. So that's why we have a vaccine. Yeah. Okay. Yeah. Oh, say Mia was saying your brother has shingles, right? Yeah. So this is actually a pretty bad one. Yeah. So never had a chicken pox. You won't have a shingles. You never know. Maybe sometimes chicken pox symptoms are not clear, but then you have a virus getting to your body, hiding there. Yeah. So that's why it's possible. Okay. But if you can get a vaccine, it can help. Yeah. Prevent. So polio is what is causing the motor neuron damage spinal cord. That's what affecting the muscles, lower limb usually. But polio, I have to tell you, on a board exam, commonly tested is how is it transmitted? Polio. Polio is through digestive tract. See, in the past, we all remember polio through oral fecal transmission. But nowadays, seems like people cannot remember. What's the reason? I remember polio vaccine used to be oral vaccine. So the vaccine, you drop into the mouth and let baby swallow it. This is why it's swallowed, because it's what? Digestive transmission route. But nowadays, that's not convenient, right? Put something in the mouth to swallow it. But then polio also, right now, they use injection. But when it's injection, when question asks you how polio is transmitted, yeah, it's actually through what? Still through digestive system. Contaminated food, yeah, so that's what I call oral fecal, feces, through mouth, yeah, so and then you get a polio, digestive system, okay? So polio virus, but we do have vaccine. Yeah, and vaccine. Okay, so polio vaccine. Well, polio vaccine we use the dead material, so we can give to the baby very early. Do you know how early we can give polio? 2 months, maybe 2 months old. Yeah, so you get a polio. Okay, but not for MMR or chickenpox. At least to wait till 12 months. Last one, rabies. Rabies is not very common. And you do have vaccine rabies, but not everybody gets it. Only in people like a scientist, biologist that deal with the wild animals, right? Or for military personnel, right? The battlefield, you never know, right? And there's some animals in it. So rabies, and rabies is transmitted by what? Animal bites, right? Animal bites. People before all believe it's dogs, but dogs now is also vaccinated. So dog bites is less likely. Most likely is what? Some wild animals, okay? So including like what? Squirrel, be careful. Yeah, sometimes people see squirrel, try to play with a squirrel. Squirrel may have rabies, yeah. Squirrel, raccoons, and skunks. That's stinky, skunks, and even bats. Bats. If you got a bite by a bat, yeah, but not those Austin, small bat. I don't think they're gonna bite. So any wild animals, if you got a bite, you gotta be careful. Yeah, there's a possibility of rabies. Otherwise, dogs is almost not likely because all dogs, especially pets, those are vaccinated. Yeah, rabies vaccine. Yeah, they get it. Okay, so that's you just have to know. Rabies is also virus. Yeah, rabies is virus. But you know what? Those infectious diseases, we're gonna have microbiology review. We probably won't mention again. Yeah, so that's why you pay attention to that later. Okay. So next one, we're gonna look at genital urinary. Yeah, genital urinary is mainly we talk about male reproductive and also urinary. Yeah, and female urinary too. See, those something you see right away is male ED, benign prostatic hyperplasia, or prostatic cancer. Okay, so those three. Yeah, also sometimes we see is a high yield. Yeah, and questions on a board exam. For ED, they will ask you a question. What is the problem? ED. ED is not about a muscle. It's not about the nerve. Okay, it's not about other tissues. Basically, is what? It's a blood vessel. That's why you have to understand the physiology. Erection. Erection is dilation of the blood vessels in the penis, and it allow more blood flow. That's why any drugs used to treat erectile dysfunction is what? Is actually the vasodilators. Something dilate the blood vessel, allow more blood flow. So this is where the concept of ED. And the most common cause of ED is what? It's actually psychogenic. Psychogenic. Mental. Yeah, mental preparedness for the sexual activity. Yeah, if it's not prepared, it's easy to get what? ED. Yeah, so this is the most common. Although some diseases, some drugs may also cause ED. Is that right? Let's say testosterone levels too low, or somebody taking antidepressant, antihypertensive drugs, and it may cause what? Erectile dysfunction. Okay, that's the one. Second, BPH. So prostate gland is enlarged, but it's a benign. That means it's not a cancer. But don't forget, prostate gland encloses the first part of urethra. So it's going to block what? The urine output. So mainly the symptoms is what? It's all urination symptoms, right? And retention of urine. So that's benign. But compared to prostatic cancer, well, cancer is a different story, right? It's enlarged, but it's also going to spread. So there's a few questions for prostate cancer. Prostate cancer, first, try to understand, what are the risk factors? The biggest risk factor is age, age. You get older, more likely, right? The second is what? Testosterone. Yeah, it's a hormone related, just like breast cancer was estrogen. So prostate cancer was testosterone. Okay. And then we do have a screening. That's on the board exam. Men starting at age 50, you need to have screening for prostate cancer. Two things. One is a blood test, PSA, right? Prostate specific antigen. Second one, physical, digital rectal exam, right? Digital rectal exam, DRE. So why digital rectal? So you put a digit finger into the person's rectum and then to feel the prostate gland from the back, right? Yeah, to see. So this is actually what? Screening, age 50. How often you do this test or examination? Once a year, okay? You remember that. So this is in the cancer screening. We'll talk about this later too. So this is prostate cancer, yes.
I remember BT8 has a question about helping the symptom.
Yeah.
Vitamin.
Huh?
Some kind of vitamin helping the symptom.
Some kind of vitamins?
Yeah, or some herbal stuff that can help the symptom.
Oh yeah, there's actually one of them. We'll review that. It's the supplements. Supplements. Yeah, we'll have a supplements. You will see that. I think it's called what? Saw Palmato. We'll talk about this later. Supplement. Yeah, they actually can help relieve some symptoms. Actually, the prostate cancer and benign prostate hyperplasia symptoms the same. You just squeeze the urethra. Urine output is blocked, right? But cancer is bad because they transfer. Like prostate cancer, most common transfer site is what? Is bone. Up to 90%. So 90% prostate cancer patient will go to the what? To the bone. Yeah. Metastasis to the bone. Okay. And the urinary calculate, well, that's the stones. Yeah, stones, we know that. As stones blocking the urinary tract, and they also causing some damage. So it can cause severe pain and also what? Blood in the urine. Yeah, blood in the urine. So painful urination plus blood in the urine. That's a feature, right? For the stones. And the urinary incontinence. Incontinence means what? Loss of control. There are many reasons, right? Sometimes abdominal pressure is too high, right? And then coughing a lot and then keep pushing the bladder. That's called stress incontinence. Sometimes it's the bladder muscle is overactive. A little bit of urine stimulate contraction, right? And then this is called urge incontinence, urge, yeah. But sometimes it's because of what? Of prostate gland enlarged, blocking the urine output. Then when the urine accumulates to a certain point, can't hold anymore, suddenly just discharge it. Yeah. So this is called what? Outflow, abstraction. Outflow, urine outflow, come out, right? Yeah, abstraction, incontinence. The incontinence means the loss of control. There are different many reasons. Actually, there's another incontinence, very interesting. It's called functional incontinence. What's functional incontinence? A person has a feeling to pee and able to pee, but functionally disabled, wheelchair, they cannot go to the bathroom on their own without help. They will talk about, or maybe bedridden, they're on a bed. But if there's no helpers, then how can they go to the bathrooms, right? That's what they have this incontinence, okay? So loss of bladder control. Then UTI. Yeah, UTI tests a lot. I'll give you a couple of questions. Most common site of UTI is what? Is bladder, cystitis. Most common pathogen of UTI is what? What is the most common pathogen of UTI?
Cystitis.
No. Cystitis is the most common site, bladder. But pathogen, bacteria, which bacteria? Yeah, E. coli. You have to remember E. coli, right? Yeah. So this symptoms are easy to understand. Hesitant, right? Urgent, frequent urinations, right? Yeah, irritating. Yeah. But don't forget, those UTI infections are ascending. It's going back up. So from bladder, if not under control, it may go to the kidney. That's called the pyelonephritis. That affect the kidney. Yeah, so that's why the last organ affected is the kidney when they go back up. Okay. So that's what UTI. Now, why UTI is more common in females than males? You have to understand, right? Where's the structural difference? Male urethra is much longer. Female urethra is very short. Female urethra, the exit is very close to the contaminated vaginal opening, anal opening that's contaminated. So easy to get a contamination. And then what? Getting UTI. So more common. Okay. Then after that, the next two is a kidney condition, nephritic and a nephrotic. Well, there's a difference. Nephritic is inflammation. Inflammation. Yeah, and then you have to remember, it's a glomerulonephritis. This inflammation is not starting in the kidney. It's actually what? Starting maybe somewhere else. It's a streptococcus infection. So, for example, a person has strep throat. And then the strep throat body antibodies generated against the bacterial antigen antibody fighting. At the same time, they activate the complement. Then this complex, antigen antibody complement complex, and it travel to the kidney. So kidney is the secondary site, and it causing what damage? It's because of the strep throat. So it's actually called post-streptococcal. Yeah, this is totally post-streptococcal. Now, on a case study, typically is this. They give you a case, a 20-year-old person, and actually presents to the clinic with blood in the urine, blood in the urine, and some edema, swelling, and maybe a high blood pressure, But medical history shows 2 weeks ago, he was diagnosed with streptococcal pharyngitis, sore throat. Right away, you know that. It's what? Glomerulonephritis. Yeah, it's a post-streptococcal. So after strep infection, strep throat. And then what? Going to the kidney, causing the damage. So this is what it means. But nephrotic is different. Nephrotic is what? Is the kidney itself. Damage, well, through many reasons, autoimmune toxins, then causing leaking of proteins. So urine has lots of proteins instead of blood. Yeah, protein loss in the urine. And remember, proteins in the body, very important, right? In the blood, you want to what? Exert the osmotic force to hold the fluid. So when the protein is lost in the urine, so blood plasma protein drop, so the blood cannot hold water. So a lot of water leaks what? To the tissue, and it causing what? Severe swelling. So that's why nephrotic, 2 symptoms. One is what we see, protein loss in the urine. And the second is what? Severe swelling in the body. Yeah, because of what? Fluid loss due to low plasma protein. And those proteins all going to the what? To the urine. Yeah.
Could you repeat that one more time? With nephrotic syndrome related to the edema.
Causing edema.
Yeah.
Why edema? Because nephrotic is a loss of proteins. Proteins in the blood. What's the function of proteins in the blood? One of the major functions is to hold water. That's osmotic force, right? Yeah, that's what water is not going to leave the blood. So hold it. But then when the protein drop, water leaves into the tissue. Tissue has a fluid accumulation. Then what? It will edema. That's what it means. Okay? So those patients, severe edema, and then plus you detect protein in the urine, proteinuria. Yeah, so that's a nephrotic. Yeah, there's no streptococcus involved. No. It's,
so this patient, the nephrotic patient, the urine is actually not adequate. It's not enough, even though the body is a lot of fluid.
No, not urine, not adequate. Urine is maybe still adequate.
Huh?
Still adequate. Why not adequate?
So if this is the case, then the extra fluid in the
blood. So suppose you have a fluid in the blood, right? In the blood. But the fluid in the blood, the holding force is osmotic force, like osmotic pressure, hold the fluid. But when osmotic force or pressure drop because of a low protein, then fluid is going to the tissue. You're getting out of the vessels, stay in the tissue. Got it? But where the protein goes? Well, protein goes with the urine. Because the kidney has damage, allow protein. Protein suppose is a large molecule, so not easily leave the body, right? But when the kidney allow them to leave, then what? A lot of proteins in the urine. That's what you find out. At the same time, your body has a lots of edema, swelling. Yeah, so that's what happened. Got it? Yeah. So the 2 features. One is the protein in the urine. Another one is the excessive edema. Okay. Yeah. So that's called nephrotic. So nephritic is different. Yeah, totally different. The feature presentation different. One is you have the streptococcus, sore throat, start with, Yeah, so it's inflammation and causing the fight. Okay, so that's these. You may search more. This is a review. Otherwise, we talk about this topic 15 minutes. It's supposed to just kind of quickly catch it. Why this? Why this? That's it. We're talking about. Yeah. So now diabetic. Kidney failure, number one lead reason right now is what? Diabetes. Used to be high blood pressure. Both diabetes and high blood pressure can cause damage to the kidney. And finally lead to what? Kidney failure. Now these days, any kidney failure patient, you trace the cause, diabetes number one, okay, and the kidney failure, nephropathy, kidney damage, right? And then when the kidney failed, then cannot filter. So kidney failure, basically, just have to know is how do you treat kidney failure? Well, basically, it's either dialysis and waiting maybe before a transplant, is that right? Yeah, but not kidneys are not easily available. So that's why most patients just stay with what? With dialysis machine.
You mentioned that, I think you mentioned that our body only need one.
Yeah, kidney, one functional, perfect. Yeah, but if both kidneys drop, not functioning, then you have to use what? Dialysis. Yeah. But a normal person, one kidney is good. Yeah, it was actually more than enough. Yeah, that's why we have another reserve, right? But hopefully, when you have diabetes, high blood pressure, they're not going to just affect the one kidney, not affecting the other. Both are affected. So that's what the problem. Yeah. Okay. Yeah.
So usually donor of healthy people, they donate one. It's okay.
It's okay. Yeah. If everything is fine with you, you donate one. That's good. Donate one. Yeah. Okay. Okay. So this is what we did at genital urinary, not neurologic. Nervous system. Yeah, you see a lot of questions. Bell's palsy, which is called facial paralysis. And you have to know which nerve is affected. That's very important, right? It's the facial nerve, number 7. Cranial nerve, number 7. And then when facial paralysis happens, now we know that, right? Somebody's eyes, nose, mouth deviated. Here's the question. The deviation direction is toward the normal side or toward the affected side? Actually, deviation to the normal side. So let's say my right side, facial paralysis, muscle paralyzed. I cannot hold what? Muscles contracting to pull it, right? You cannot pull it. Then what? It all goes to what? To the opposite side, to the left. This you have to be clear. You understand that? Got it?
Deviation
toward the normal side.
Normal.
Yeah, because normal side muscle is very strong. You can pull it. But the disease affected side, muscle is paralyzed. So they cannot what? Have a strength. So that's what deviate to normal side. That's very important. So this is totally different from what? From stroke, right? Stroke, you can have paralysis. But stroke paralysis is what? Affect opposite side. Is that right? Is that right? Let's say right side you have a stroke. And affect the nerve is what? Is opposite side nerve. So opposite side paralyzed. Then the deviation is what? Towards stroke side. Does that make sense? Yeah, so that's why sometimes when you look at this, deviation to which side, and it can help you, is a central cause, stroke, or is a peripheral cause, Bell's palsy. And Bell's palsy, you know that what causes facial nerve affected, causing muscle paralysis is virus. Yeah, most likely is a virus. Virus attacking what? The facial nerve. Cranial nerve number 7. Okay, number 7. Then concussion, contusion. Well, that's just have to be clear. Concussion is very minimal brain tissue damage, very minimal. Or typically we don't see any particular organ damage. Yeah, so it's mostly, that's what we just say, it's kind of a little shaking the head. But contusion is what? Is the brain tissue damage, and nerve may be torn, things like that. Yeah, so the consequences, concussion is better than contusion. Contusion is more serious. Okay, so you have to understand that. And epilepsy. Epilepsy is what? Seizure. Seizure disorder, is right? Involuntary muscle contraction without known causes. Then they ask this question is, epilepsy, how do you confirm the diagnosis? Epilepsy is actually what? Why you have a seizure is an electrical discharge. So EEG, electroencephalogram. Electroencephalogram diagnose what? Seizure disorder. And then you find out abnormal electrical discharge causing involuntary muscle contraction. Electroencephalogram. Okay, EEG. So that's for epilepsy. Seizure, right? Epilepsy is a seizure. Vertigo. What's vertigo? Vertigo is not just simple dizziness. It's actually a feeling of what? Rotating. environment. So let's say you feel like, you know what, everything is rotating. Yeah, make you feel dizzy, right? That's called vertigo. So you have a feeling sensation of spinning sensation, vertigo. A vertigo could be the brain problem. It could be the ear problem. Remember, ear, this is actually, we'll talk about later. There's a condition called Meniere's syndrome. You have three important features, right? Meniere's. One is what? Vertigo. Second one is what? Ringing in the ear, tinnitus. And number three is what? Is the hearing impairment. Hearing impairment. Yes, those three combined. Hearing impairment, ringing in the ear, and vertigo, which is called Meniere's syndrome. Meniere's. Okay? Yeah, this is what we'll talk about later in the ear part. Now, the next one, headache. Headache is always on the board exam. Keep in mind, when we see headache, we're talking about headache, just a headache. It's not part of other diseases. For example, a person has a high blood pressure headache. Well, this is expected. Your blood pressure is high. So that's not in this category. A person has a brain tumor. You have a headache, right? Or that's because tumor causing that. But here we see headache as a symptom is also on its own a disease. Headache.
Do we call that primary?
No, we don't call, you can call primary, just a headache, essential headache. Three types, that's what you have to identify. An easy way to remember. Tension headache. Tension headache is what? Is a muscular headache. Muscular. Muscle tension. A lot of time with stiffness of the neck and the feels the head is wrapped by a band, you know? Yeah, tension headache. So the treatment is for tension headache, just relaxation, meditation, vacation, right? Yeah, so relax, tension headache. So it's related with the muscle tension, stress. Now, migraine is different. Migraine headache, based on the nature, is what? It's a vascular headache. Vascular. What do you mean? It's a blood vessel. So people have a migraine headache, they feel like the headache is what? Is pulsating. Pulsating. Jumping. Pulse. You have a pulse. It's a blood vessel. Yeah, blood vessel condition. And then migraine headache, we know that typically is what? One-sided, right? On one side. Then cluster headache. Well, cluster headache, sometimes we call it is a neural headache. It's actually a very severe pain, stabbing pain. And mostly is what? Forehead, behind the eye, forehead. And you know how bad it is? This headache sometimes can wake you up from sleep. You're in sleep. Suddenly you have a headache and you wake up. And when you wake up, you feel like, why I wake up? Because why? If you have a severe headache. This is nature is more like a neural, like a nerve. Very bad, stabbing pain or excruciating pain. Excruciating pain, yeah. So this is called cluster headache, okay? So that's what based on the nature. If you see a case, when you describe it like a what, and then you know diagnosis which type of headache. That's basically, okay? So different kind of a nature, so for headache. Then TIA. TIA, another name is called what? Mini stroke, yes.
So migraine, there's migraine all usually on the side?
One side, single, unilateral, not both sides, one side on the side.
I mean, usually on the temple area?
Not this is temple, just the half of the head.
Lobe?
No, not about lobe. Those headache, nothing with the lobe. Why? Because if you have a lobe, that's a disease, secondary headache. You're talking about? Let's say you have a tumor headache. Well, that's a tumor cause that. But this headache, just the headache is a headache, nothing else. So headache is. Got it? So if you do an extensive check, examining, you don't find anything. Just a headache. Okay? If you have a cancer, you have high blood pressure, you have a tumor, you have a stroke, you have anything, trauma, it does not belong to this category. You can never call. Huh?
It could be neural, right?
Well, neural still. When you say neural, it's not about a nerve. It's about the nerve nature. Like a muscular because of muscle tension, muscle nature. Vascular because it's jumping, right? Like your blood vessels, you have a pressure, right? And the neural is just like a nerve. When nerve causes pain, it's very severe, just like. But when you really check the brain nerve, there's nothing wrong. Nothing wrong. Okay? Yeah, nature. So those names we use is not a cause. Yeah, just the nature is like that. Okay? So that's what the head. Now, TIA is a mini stroke, which means small branches of a nerve, of the blood vessel is blocked. And the temporary cause what? Some symptoms. Transient, ischemic, lack of blood supply attack. Like suddenly a person, one arm seems like suddenly cannot move. and a few minutes later, and then you can move again. Suddenly, one eye seems like it's blind, cannot see, and all of a sudden can see it. That's called TIA, transient. But it is a mini stroke, mini. It tells you something big is going to happen. So you better take care of it, okay? Yeah, so this is a temporary. Now, the real stroke is called cerebral vascular accident, CVA, or stroke. The one, big one. And the stroke, you have to know, right? There are actually two types. One is the blood clot induced, and it causing lack of what? Blood supply, right? Ischemic stroke. Another one is what? Is the blood vessel supply the brain rupture. It causes severe what? Bleeding. It's a loss of blood, right? So either ischemic is also called thrombotic, right? Or ischemic. So ischemic is the result of thrombosis, clot formation. And then you block the blood circulation, so no blood supply. And hemorrhagic is what? Is bleeding. Hemorrhagic. Yeah, bleeding, because the blood vessels are ruptured. Then you know what? You don't have a blood supply. Okay, so that's a stroke.
So you said two kinds. One is the clotting.
Yeah.
And one is the rupture.
Rupture, yeah. And then they ask you a question is, which of the following you think are the signs that may suggest a person has a stroke? Well, a lot of time people know that, right? Half of the party kind of cannot move, or sensations changes, right? Or maybe suddenly the eyes are blind, cannot see it, or the face was deviated. Is that right? That's what usually happens. Yeah. So basically, just like that. Anything sensory, motor, movement, right? And also sometimes it could be also like psychiatric symptoms, like a person, yeah, suddenly the behavior, the mental activities, your behavioral changes. Yeah, it may also indicate a stroke. As a person used to be very talkative, all of a sudden sitting there not talking, right? Or if try to talk, stuttering, the tongue is not move smoothly, and then you suspect, stroke. Got it? Yeah. So this is something you have to know how to observe. Yeah, but they give you a case asking you, what actually are signs that may suspect this person may have a stroke.
If we see this, you call 911?
Oh, yeah. Call 911, yeah. If you see this. So you try to see, seems like the change is pretty obvious, right? Yeah. Okay. So this is for stroke conditions, okay? Stroke. Then after that, the next one is what? Myasthenia gravis. That's just, you have to know the name. What's the disease? Myasthenia is a muscle weakness. Gravity. Gravis is gravity. What does that mean? It's actually an autoimmune disease. And the immune system generates antibody blocking the neurotransmitter receptor, acetylcholine receptor. Then the nerve was sending acetylcholine, try to contract the muscle, right? It cannot, because the receptor is blocked by the antibody. Your body's immune system generates antibody against your receptor. Then the neurotransmitter cannot bind to it. Their muscle is weak, paralyzed.
Would you please repeat that?
Yeah. Nerve controls the muscle. Muscle is the receptors, right? Neurotransmitter bind to the receptor and activate the muscle contract. But now you have an autoimmune disease, immune system generates antibody blocking this receptor. So neurotransmitter cannot bind to it. The muscle is paralyzed. So that's called myasthenia gravis. Why gravis? Because typically the effect is what? The top muscle first. So person start symptoms is what? Eyelid drooping. Eyelid go down. Cannot open eyes. And then facial muscle gets weak. It cannot make facial expression. And then affect throat, cannot swallow. Yeah, swallow muscle. And then all the way down. Now, actually, usually don't even pass the diaphragm, because when diaphragm paralyzed, you can breathe and you died already, right? So the leg may not even be affected. That's why it's a descending due to gravity, upper part first. Yeah, so this is called myasthenia gravis. So the nature is what? Is autoimmune. Okay, so you have to know that. Anybody blocks that. Then Parkinson's disease. Well, Parkinson's, you have to know a few things, right? It's a motor condition, degeneration. And first of all, where in the brain neurons degenerated that cause Parkinson? Area in the brain is called basal nuclei. Basal nuclei. So this you have to know. And also the neurotransmitter is deficient. Which neurotransmitter for Parkinson? Deficient. This you also have to know. Is dopamine. Dopamine deficiency. Yeah, dopamine. Okay? Dopamine for Parkinson. And the Parkinson has what? Has the motor problems, right? Like a face, no facial expression. We call mask face. Mask face, right? And then the movement is what? Is rigid. It's like we call what? Cogwheel. Like a cogwheel and what? Boom, 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 boom. Cogwheel. Traction. And then resting, not doing anything, they have what? Tremor. If you think about a person, you want to see right away. There's a famous boxer, Muhammad Ali, right? And also there's a movie star, Michael J. Fox. And they all suffer from Parkinson's. So when they walk, the gait is not stable. And their muscle activity is not very smooth. It's like cogwheel, cogwheel. Then the balance is lost. So it's a neurotransmitter, it's dopamine. Brain area is the basal nuclei. Okay, so this is just have to know, particularly, yeah. And then the problem is what? That's not autoimmune. It's degeneration. Okay. Then after that is what? Is the peripheral neuropathy. Yeah, peripheral neuropathy usually is a complication of other diseases, diabetes, peripheral neuropathy, vitamin B12 deficiency, neuropathy, HIV infection, and neuropathy. So affected peripheral nerves. Yeah, so typically the person is what? Sensory nerve, abnormal sensation. Yeah, we call tingling, pins and needles. Or motor is what? Weakness of muscles. Yeah, peripheral neuropathy. And as I said, it's not on its own disease. It's the complication of other diseases and then causing this what? Peripheral neuropathy. Okay. Trigeminal neuralgia. Well, trigeminal is cranial nerve number what? Number 5, which controls the facial sensation. So when this nerve 5 is infected with a virus, and then causing what? Severe facial pain. Remember, facial pain, you have 3 branches, trigeminal, right? The upper is to the eye area, the middle is to the nose, and the lower is to the mandible, 3 branches. So trigeminal neuralgia is the facial pain due to virus infection of the trigeminal nerve. Trigeminal nerve for facial sensations, right? Sensations. But they do ask a question. If somebody has a trigeminal neuralgia, so you have a symptom, facial pain, what other functions may be affected? What do you think? This is test your anatomy, physiology knowledge. Because trigeminal nerve also controls what? Chewing muscle. So those people may have a weakness in chewing. Yeah, they cannot have a strong chewing activity. Why? Because chewing muscle is also controlled by trigeminal nerve. So trigeminal neuralgia is a nerve pain, sensation part. But sensation part also have what? Motor function affected. Yeah, because this nerve also controls motor, right? Chewing muscle. So that's anatomy knowledge, basically. Yeah. But let's see if you can quickly think about that. So they give you a list. Oh, the person may have a problem to open the eyes, to make a smiley face, to stick out the tongue, and then no, those are not related. Related is what? Chewing muscle gets weak. Yeah, chewing muscle, okay? So trigeminal neuralgia. Post-hepatic neuralgia, that's the one we talk about, that shingles. After shingles. Shingles is herpes virus, and then causing severe nerve pain. Shingles, okay? And shingles, chickenpox, same virus, okay? Yeah, and shingles can be prevented by what? Vaccine. Yeah. So people say, I got a shingles.
Possible.
Can they? Not always. Yeah. Sometimes doctors still will recommend get a vaccine. So even though you have shingles, right? They say, yeah, still let's get a vaccine. Yeah. Or if you say, I have chickenpox, it doesn't matter. They always give you a shingles. Okay. Now, multiple sclerosis. That's another thing you have to know. This one is what? Autoimmune. Yeah, it's antibodies destroy the nerve myelin sheath. Myelin sheath is a lipid-containing substance, cover the axons. So when they are damaged, their nerve is no longer protected. So affect nerve transmission, nerve functions. Multiple sclerosis. So autoimmune, and the condition, the disease nature is demyelinating. Demyelination, myelin covering is gone. This is the ones you have to know. Okay, I think it's about the time right now. Let's take a break. Yeah, come back. Actually, we're gonna move on. Okay, so demyelination for MS. And nature is autoimmune, immune system attack, myelin sheath destroy. So no myelin. So nerve all become naked. So transmission will slow down.
What is the symptom of that?
Well, symptom has a lot. Sensory symptom. Sensory. Oops. Yeah, it's time. Yeah, so we'll talk about this. Yeah. Continue, put it back on recording. Okay. Yeah, so we're looking at, see, MS, we just mentioned, is multiple sclerosis. The nature is very important, demyelination, which is caused by autoimmune. Immune system destroy the myelin sheath, so affect the nerve, right? So if it's sensory nerve, so your sensation change, tingling, pins and needle sensation, or visual optic nerve affected, person may have a blurred vision, or affect the motor neuron and then causing weakness of muscles. Yeah, so all depends. Variable, different things. Yeah. And then ALS. Now, ALS is another more serious than MS. Why? Well, first is amyotrophic lateral sclerosis, used to be called Lou Gehrig's, because this one only affects the motor neurons. And then it's gradually, it gets what? Muscles gets stiff, cannot function. That's why I like the translation. You know what? ALS, they translate into Asian language, Chinese, Japanese, Korean. You know what it translates? It's called gradually frozen disease. Gradually frozen disease. So a person, little by little, gets frozen. Yeah, muscles not working. Yeah, you probably see that. One of the scientists, right, who find the black hole. Huh? What's his name? Yeah, he was actually on the wheelchairs. All right. Yeah, so that's ALS. So ALS is much shorter, the disease course. So most patients will die because when a motor neuron, like diaphragm, is affected by motor neuron, right, movement, then just gone. Okay, so ALS. But the thing is, ALS, we still don't know what causes that. We suspect maybe some genetic, some autoimmune, but this never confirmed. It's like MS, totally confirmed. Multiple sclerosis, which is actually the autoimmune condition. Okay, that's for sure. Then last one, that's just the name, reticulopathy. Reticular is the nerve root, reticular. So nerve root problem. So when we say that when the nerve leaves the spinal cord, the root, let's say it's pinched, it's pressed, or it's inflamed. That's why with the pressure, right? Like a person have a herniated disc, right? And a disc herniated, compressed on the nerve. That's called radiculopathy. So that's why I give you an example here on the screen. You see sciatica, sciatic nerve. When sciatic nerve is pinched, pressed, inflamed, and then they cause what? The pain. When sciatic nerve goes down to the leg, right? All the way down can go to the foot. Yeah, radiating pain. So this is called radiculopathy. Radiculo means nerve root. Yeah, so nerve root problem. Okay. Yeah, so this is sometimes on the test. They don't test you detail, just give asking you this. Yeah, what type of disease? The name, like a more definition. So you know that, okay? So radiculopathy. So then after that, we're gonna have a geriatric condition. Geriatric is what? Older people, right? Geriatric. Yeah, elderly diseases. Yeah, one of them common, Alzheimer's. Yeah, Alzheimer's disease is also called senile dementia. Yeah, and actually on the board exam, they do ask questions, Alzheimer's, older people, right? They say 80-year-old woman was brought by her daughter to the clinic complaining her mom easily get lost, you know what, in the street, and they forgot to pay the bills, and it kind of things like that. So maybe Alzheimer's, they ask you, how do you evaluate? First evaluation is what? Yeah, you probably know that, right? This is actually recent board exam they have it. It's called Mini Mental Status Examination, MMSE, Mini Mental Status Exam. So they have a series of questions. Ask a person to see how they respond, and it give you some idea. Yeah, and if a person really have Alzheimer's conditions. Okay, yeah, so it's kind of a question-based, yeah, for a screening for Alzheimer's. Okay. So this is the one. And we do notice, yeah, Alzheimer's disease patients, one of the neurotransmitter is low, which is acetylcholine. So that's what we have, like a pharmacology we review. They have drugs that can block or inhibit the acetylcholine esterase enzyme. So you block this enzyme. So this enzyme can no longer metabolize neurotransmitter acetylcholine. So more acetylcholine available, yeah, to improve some of the functions. Yeah, so basically, that's pharmacology. We'll talk about that. So when you treat, how do you treat Alzheimer's? Alzheimer's, it cannot be reversed. Its only treatment is for symptomatically help what? Relieve some of the symptoms. Yeah, or slow down the progression. Progression slows down. Okay? Yeah. Memory loss, cognitive function impairment, right? So this is Alzheimer's. And the other geriatric, they ask question, what is a presbyopia? Presbycusis, that's easy. Presbyopia is just like an older vision. Yeah, you need a bifocal, near, close, far, distant vision. It's all bad. So you have to use a special glasses, Yeah, so typically top is distant. Bottom is a reading, right? Yeah. This is a presbyopia. And then presbycusis is elderly what? Hearing. Yeah, that means the hearing impaired in elderly people. Yeah, so this is easy to understand. Presby means elderly, presby. So presbycusis, presbyopia, okay? So elder vision, elder hearing. Then after that, you have another one. Now this is being tested a lot. Osteoporosis. Osteoporosis also seen in elderly people, and women are more likely to develop osteoporosis than men. Why? Main reason is because of the hormone drop. Because estrogen can facilitate calcium deposit in the bone. When a woman gets older after menopause, is right? Then what? Estrogen level drop. So the calcium deposit what? Decreased. Yeah, so that's why easy to get what? Osteoporosis. Okay, so that's the first thing. Second thing is osteoporosis. Now this is a question they ask. Post-menopausal woman, after menopause woman, the most important health hazard, the health concern is actually what? Answer is osteoporosis. So loss of bone minerals. Okay, then the next one, How do you diagnose osteoporosis? Well, you have to do a bone scan, which is actually the particular one you have to know that the bone mineral content scan, or just the bone scan, bone density scan. Actually, there's another name always on a board exam. It's called what? DEXA. DEXA. They don't ask what's DEXA, but DEXA full name is what? You don't have to even worry about that because name is very long. It's a very long name. It's a dual energy X-ray absorptiometry. So you measure the X-ray absorption rate. You have just the DEXA. DEXA is a scanning for women to see if you have osteoporosis. Now, routinely, medical standard is a woman age 65 or above should start to get what? DEXA, bone scan, okay? To see a bone mineral contents or bone density, like a minerals, you still have enough minerals or not, which is for osteoporosis diagnosis, okay? Another osteoporosis, they ask you a question is, well, of course, you're going to give calcium supplement. Why just to give the cell calcium supplement is not going to help for osteoporosis? Why? Because dietary calcium will not be easily absorbed without the presence of a vitamin. Which vitamin? Vitamin D. So that's why if you give supplement, you have to have calcium and vitamin D combined, because vitamin D helps calcium absorption. Okay, so this is also very important. And osteoporosis is not always with age. Sometimes osteoporosis can occur even at younger ages because of the use of a long-term steroid hormones. So let's say a person has autoimmune disease, right? Immune system is overactive. So we use steroids, glucocorticoids, cortisone. The cortisone long-term use can cause what? Osteoporosis. Yeah, osteoporosis. And the biggest risk of osteoporosis, after someone has osteoporosis, what's next? Oh, the bone minerals is missing. So that's why easily get a what? Fracture. So the biggest concern is a fracture. Okay, fracture. Osteoporosis is a fracture. Okay, so this is actually osteoporosis, really. Always different kinds of questions they ask, okay, about this condition. It's just degeneration condition, okay? Then let's see, psychiatric disorder, psychiatric. Yeah, psychiatric, mainly is you just have to understand the definition. So then you would know what it is. Yeah, for example, insomnia is just a sleep disturbance. But broadly speaking, insomnia is not just cannot fall asleep. Actually, many things. Sometimes what? Easily wake up. Or sometimes after wake up, cannot fall back to sleep. Right? The sleep quality is not good. Or sometimes a lot of dream disturb the sleep. So any kind of sleep disturbance, yeah, it can be in the insomnia category. Okay? And the most common insomnia is what? Psychogenic, mental conditions. That's the most common cause, okay, for insomnia. And then chronic fatigue syndrome. Chronic fatigue syndrome, a lot of time is together with other conditions. For example, fibromyalgia, insomnia, is that right? Or a person has HIV infection, and then or chronic hepatitis. Well, those people always feel tired. So chronic fatigue syndrome is just a lot of time is associated with many other diseases. Yeah, chronic fatigue, always tired. Mood disorder. Well, mood disorder is you talk about a person's affect, right? Depression, or sometimes bipolar. Bipolar is just the one. Mostly depression, but at one point it can actually have a maniac attack. So that's why they call bipolar. It swings, right? And the depression and the bipolar. And you probably have to know depression mainly is which neurotransmitter is deficient. For your emotion, you need the serotonin. So serotonin is deficient. But when a person has a chronic depression, body try to handle this stress. That's why you have another hormone maybe high for depression patient. That's because of the stress, which is what? Cortisol. Cortisol may be high, but the serotonin receptor is low. Serotonin. So that's why a lot of drugs for depression, antidepressant, is what? Is try to increase those neurotransmitter level. So the most commonly used antidepressant drug is called SSRI, selective serotonin reuptake inhibitor. So you block the reuptake, so make sure serotonin more available, right? And it continues having effect. Okay.
Serotonin reception is low while the other is high. Which one?
No, serotonin, selective serotonin reuptake inhibitor.
Yeah.
Serotonin has the effect, improve your emotion, right? For avoid depression. But when a person has depression, serotonin probably level is low. How do you treat? So we try to block the serotonin reuptake. Reuptake is after the effect. So we block the reuptake, the more serotonin available and acting on the nerves, then improve your depression symptom. So that's what the drug is called SSRI, pharmacology, right? Why SSRI can treat depression? Because SSRI will increase the what? Serotonin level. Then continuing acting on the neurons that can improve what? Your emotion. Yeah. Okay. So that's what the reason. That's a pharmacology mechanism. Yeah. But it's based on this physiology. Yeah. Eating disorder. Yeah, eating disorder is anorexia nervosa, bulimia nervosa. Well, you just have to know the difference. Anorexia nervosa is what? Is refuse to eat. Seems just like no appetite. Even though sometimes have appetite, but just don't want to eat because mentally obsessed with the false body image impression. So a person is saying, I'm too fat, very skinny already, still saying too fat. Yeah, so this is the problem. And the bulimia is what? Is a binge and a purge. Eat a lot and then feel guilty. Induce vomiting and then what? Yeah, so the big difference, one is never eat. The other one eats a lot. So that's why the second one, the weight, body weight is not changed. Maybe even gain weight. But the first one is a severe weight loss. Okay? But also behind this eating disorder is all we believe is what? Is actually related with the mental conditions. So that's why to treat both eating disorders, we use what drug? Actually still antidepressant. So use the same what? Antidepressant drug to help. Yeah, but also they like to ask another question. A person has eating disorder, if you notice that, especially anorexia nervosa, refuse to eat, right? Very light body weight, so skinny, right? They ask you, those patients, most commonly they present a symptom is what? Amenorrhea. They're not going to tell you I have an eating disorder. No, they don't recognize that. They will say, how come I have no periods? That's why, especially those are in the teenage girls presenting with amenorrhea. You suspect maybe it's this because especially very skinny. And the second, they ask a referral question. If a person you suspect have anorexia nervosa, who you should refer to? Well, people say, oh, amenorrhea, let me refer to a gynecologist. And then maybe very skinny, maybe a nutritional problem. Let me refer to a GI doctor. Actually, those are all wrong. The right answer, refer to psychiatrist. Mental disorder, psychiatrist. Okay, so that's the answer, psychiatrist. Why? Because this condition is a psychiatric disorder, eating disorder. Okay, so you have to understand that. Then anxiety disorder. Well, that's anxiety, anxious. Yeah, that's basically like a panic attack, obsessive compulsive disorder, OCD. OCD is actually two aspects. Obsessive is repetitive thinking, like keep thinking something, like obsessed. But the compulsive is what? Is keep doing something, keep doing, repeating. Yeah, let's say a person leaves the house. Every time he leaves the house, he needs to go back, check the stove, check the window, check everything. Well, you check one time, two times. People think, yeah, you're kind of a little bit obsessive or whatever. That's fine, which is not a disease, it's just personality. But if a person has to go back, check 5 times, every time leaves the house, oh, wait a minute, driveway, you get back to the house, double check. And then even get out of the driveway on the road. Oh no, I think I forgot something. My stove was on, so go back. And then, okay, everything checked, fine, and leave. And then come back one more time. Oh, that's too much. That's a disorder. Okay, there's actually subconscious stress in there. And it's very interesting, OCD patients, if you need a drug treatment, same thing, antidepressant. Some of the neurotransmitters are not enough. Not enough. I remember I got a feedback. A student told me, yeah, I had a question. I was saying this patient, he said he was like, shaking hand with someone. And there you are. You wash the hands 10 times. Wash it. No, let me wash it one more time. Repeat it, washing the hand 10 times. What kind of disorder? OCD. That's OCD, okay? You wash once, good habit. Wash twice. Okay. Wash 3 times. People just say, you're too much. But if it's done, which is fine, you have a personality, right? You're kind of obsessed with that. Then, but wash 10 times. Oh, that's a disease. Okay? So remember that. So this is usually with anxiety, kind of anxious conditions. Yeah. Now, PTSD, we know that. This is actually a traumatic event after that, right? And it caused some stress, sometimes flashback. Lots of military personnel, right? Yeah, and they have PTSD. This we know that. You know what? PTSD, if you use the Western medicine treatment, same thing, antidepressant. Everything just to remember. Psychiatric, a lot of those, right? The actual depression, eating disorder, and anxiety, and PTSD, and all of those are what? Antidepressant. Only thing not antidepressant is what? Is the next one, schizophrenia. Schizophrenia is different, which is actually what? Is the one neurotransmitter is too much, overactive, hyperactivity, dopamine, too much. So that's why to treat the schizophrenia, we use anti-dopamine drugs, try to block the dopamine receptors, okay? But what's a schizophrenia? Schizo is a split. Phreno is the mind. So a person has split mind. The person's thinking process is different from the reality. So it's different. So they believe in something which is actually not real. Okay, so that's why sometimes we know schizophrenic patients, they always have hallucinations. Hallucination means what? Means a feeling, a sensation of something that is not there, it's absent, but they feel like that. Most commonly is what? They hear what? Voices, hear voices. You see schizophrenic patient, they were talking, and he asked them, who are you talking to? Wait a minute, I have somebody is talking to me, but you don't see anybody was there, right? So that's a schizophrenia. And also thinking process sometimes is bizarre, different from the reality, okay? So that's a schizophrenia. The schizophrenia, too much what? Dopamine. You have to remember that, okay? Dopamine. And there's a strong genetic link, too, with schizophrenia, okay? Schizophrenia. Then the last one about a mental disorder here, we have to know very seriously is called what? Suicidal. So lots of mental disorders, a person may have suicidal idea, or maybe actually really commit suicide. Suicidality. Actually, somebody was asking me a question on this just recent, a couple of weeks ago. Yeah, they say a patient comes to the doctor's clinic saying, thank you for all your help these years. Today is my last visit. Yeah, to see you. And then I think starting tomorrow, everything is going to be fine with me, So I will not come to bother you. Yeah, so you take care. And what? Then the acupuncturist thinking something wrong. It's not right. And obviously you may suspect the patient may have what? Suicidal ideation, right? May plan to terminate his or her own life. So in this case, what is the appropriate management? Like how you manage this case? Well, we have some practice questions. Sometimes we have it. Refer a patient to a mental health facility, or even we have to call 911. Well, that's a medical emergency where someone try to kill, right? That's why people understand. But you see, we don't have those choices. Then I said, what other choices I have? Well, one choice is call 911. Do we have to call 911? I said, you know what? That's probably could be 911. But if no 911, then what? Call police. There's a choice. Call police. I said, that's the correct answer. Same thing. You can directly call police. I have a patient in my clinic, and they tell me he's going to commit suicide, right? And what should I do? Or can you come to help? Yes, the police will come to help you. So I think this is the correct answer. Because on the test choices, no 911, no mental health facility, no emergency room, no nothing. But one thing they have it is what? Is call the police. And other things doesn't make sense. Call another more experienced acupuncturist, okay? Or ignore that. That's not my business. If you want to kill yourself, go ahead to kill yourself. This is obvious. This is wrong, right? So as a healthcare providers, if you notice a patient has a suicidal ideation or plan, you're supposed to be very cautious. Yeah, don't let patient go. So this is one. So I think call police probably the best choice. Yeah. Okay. So suicide, but usually that's in the more advanced stage when patient will actually have this kind of thought. Okay. Yeah. Then addictions. Yeah, addiction. Of course, we know that, right? So it's addicted to certain substance abuse, but that's usually with what they give you a case. If a person, bring to the hospital, and I think for addiction cases, on the board exam, they would usually test is you pay just one attention, you would know that. They say a homeless person is brought by the police to the emergency, okay? And when you check, the person's kind of unconscious and it was sweating and the skin is cold and whatever. But look at the pupil. If the pupil is very small, pinpoint, that's heroin, pinpoint pupil size. But if the pupil is dilated, most likely cocaine, amphetamine. Yes, because cocaine and amphetamine, sympathetic, dilated. And the heroin is the central nervous system suppressant. As the pupil is getting smaller. So pupil size can help you. Addiction, what specific drug addiction? Yeah, that's what just judge on pupil size, okay? That's why, remember that. Heroin, very small pupil. Cocaine, widely dilated pupil, okay? Then ADHD. ADHD is just a hyperactivity, right? Sometimes lots of energy. And then school performance, job performance, relationship, all messed up. Yeah, because it's kind of a mental. But then there's a question: why ADHD patient? We give them drugs, which is a central nervous system stimulant. It's already overactive. Yeah, we give the stimulant is try to reset the person's central nervous system. Hopefully, can have a better control of those activities. Yeah, that's why you probably heard about that, right? ADHD patient. Sometimes we give them drugs. Ritalin is one of them. It's a derivative of amphetamine. We do give amphetamine, which is Adderall, amphetamine, yeah, to treat ADHD. Adderall is the central nervous system stimulant. But why you stimulate? They're already overactive. Yeah, the purpose is to stimulate the nervous system, can have a better control on the activities. Yeah, so that's why we do that. ADHD, okay, ADHD. And then more poor attention, that right? Person cannot focus, lots of energy, right? Yeah. Autism, yeah, autism is also a neural condition we just mentioned earlier. Some people say maybe it was vaccine, could be some genetic factors, or sometimes maybe a perinatal around birth. There's something happening, like a delayed or prolonged labor process, or sometimes when maybe, there's some other mother, diabetic, hypertensive during pregnancy, all kinds of it. It's very hard to exactly figure out why autism occurs. Autism, what the effect is what? Affect babies, right? Kid and the development stages, all the way along, right? The intelligence and then the motor activities, and then the other, right? Communication, speech, and so all kinds of, but overall, autism, we still don't know. And there's no effective treatment. Basically, it needs lots of people to take care of that, lots of resources. Autism, okay? So this is still a field, need more research, try to find out these conditions, okay? So it's all developmental, physical, mental, emotional, developmental defect, with autism, okay? So this is the psychiatric part. Now, dermatologic. Dermatologic, you just have to know definition, main feature. So when they give you a case, easily you can find out. What is that? First of all, burns. Well, burns, we know that, right? But a lot of time people think of burns, it's just what? Fire, heat. Could be. Or most common, yes. But burns can also caused by what? Chemical. Radiation, electricity, is that right? They all can cause burns. Yeah, in addition to heat, right? And then burns is what we learn in anatomy physiology. You probably have to know is how do you evaluate the burns percentage body area? Remember, our body has a 9 of those 11% regions, right? So totally 99 with genital area 1%, right? So if they say this area burn, so you can calculate, the percentage burn. Okay, and the burns also another thing is the degree. First, second, third by the thickness. Epidermal, first degree. Dermis, right, affected, second degree. Hypodermis affect, third degree. And the burns, well, they do have questions like for even in acupuncture, when you use moxa, right? And there's the risk of burn. Immediate burns, the biggest concern is what? Is dehydration. They lose lots of fluid. But more long-term concern about the burns is what? Infection. And why? Diabetic patient, if you get a burns, the result more serious. Why?
No neural sense.
No sense. You burn, you don't even know. And second, poor circulation. If you want to heal, you need to have a good blood supply, right? And because circulation is not good, neural sensation is not good. So diabetic patient, when you get a burn, you know what? It's very serious, because it's going to affect the heating and detection even. You cannot even easily detect it. Okay. So this is about the burns. And the burns also, remember, Chinese medicine is mostly considers about infection. When there's a moxa burns, is right? The acne. Acne is caused by bacteria. Yeah, it's because of a hormone influence, puberty. Yeah, puberty kids because of excessive sex hormones. And then we have very active what? Sebaceous glands, oil secretion. And then if it's not clean, and then the what? Oily substance stuck in the duct, and then allow bacteria what? To grow using those materials, right? Causing what? Acne. So acne is a bacterial infection. Okay, bacterial infection. Contact dermatitis, that's by contact. You wear gloves, latex gloves, you got what? Rashes, contact. And then you touch something, like we know poison ivy, right? You like to walk, jog in the bushes, right? And you touch some plants, you walk in the backyard, and then you know what? You get rashes. That's a contact dermatitis. So you have to have a contact. So that's what I mean. If you see a contact history, contact dermatitis. What's eczema? See, eczema is a term very vague. Most dermatologists would say eczema is a term with temporary use for an unexplained skin rash. Skin rash, unexplained, we call eczema, temporary. Okay? But if we can figure out exactly what it is, then we use different names. For example, it could be contact dermatitis. It could be psoriasis. Is that right? It could be lupus. Well, that means you confirm, right? Or maybe fungal infection. Then you don't call what? Eczema. So eczema generally is kind of a broad term used for any skin rash. We don't know the exact cause, eczema. Okay? And then tinea infection, that's a fungal infection. Tinea, fungal. For example, tinea pedis is a foot, athlete's foot, tinea pedis. Tinea capitis, so you have a fungal infection on the head. Yeah, sometimes a loss of patchy hair, we call ringworm, right? Ringworms, fungus. So tinea infection, you have to know, is just a fungal infection, fungus infection. Psoriasis. Psoriasis generally we believe is another one, autoimmune disease. Some autoimmune nature. This autoimmune immune system mistakenly attack what? Skin tissue. Yeah, it causes. And you have to know psoriasis mostly is where? It's on the elbow, on the knee area, and it's also interesting on the extensor side, extension. Elbow extension is in the back, extended. Knee extension is on the top. Extend your knee, right? Extension. So extension side, skin rashes. Or sometimes what? Even on the head, in the back. Why? Because when you extend your head in the back, you have some rashes. So this rashes feature is very important, psoriasis. When they describe like this, the base is red. On top of it, it's very dry and scaly, scales. scaly. Okay, dry and scaly. Silvery scale, colors like a little silvery white. Yeah, peel it off. Okay. Or somebody was asked, just saw the question, what is the most common type of insomnia? Again, well, most common is psychogenic, psycho. If you have some stress, you have anxiety, you have a depression, those all mental problems, right? It causes insomnia. Although some other condition can cause insomnia, but not as common. For example, if you're suffering from pain, you have insomnia. That's what we understand because the pain affects you falling asleep, right? Or some other things, you have a GI, acid reflux, but that's a disease, real. But overall, insomnia is mostly mental conditions, most common. Okay, scaly, silvery scales on the red basis, rashes, extensive site of the elbow and the knee or in the back of the neck. Yeah, so psoriasis. And then it comes and it goes. Remission, recurrence. Yeah. Okay, it's very hard to cure. We see that. So the rash is very typical. Psoriasis, the rash. Okay, yeah.
Does it also occur on the foot, on the normal side of the
You
foot?
can, but not very common. Typically, it's elbow, knee, back of the head area. Okay, and a chronic occurrence of the psoriasis that make the skin kind of a thick, skin thick, psoriasis. Now, the other one's infection. Folliculitis, carbuncle, furuncle, and a carbuncle. Folliculitis, the hair follicle, a single hair follicle. Sometimes you see that, a hair sticking out through a little pus area. It's just one hair, folliculitis, one. But a lot of times, not just that small, right? A little bigger. A little bigger is like a boil. That's called furuncle. So there are several hair follicles. Yeah, and it has a little pus form. That's called the furuncle. But then several furuncles sometimes fuse together, make a big region with a pus. That's called carbuncle. Carbuncle combines all the furuncles. It's usually what? Bacterial infection. Staphylococcus, staph. Okay, and the pus either generate yellow pigment, so color pus is yellow, or maybe generate white pigment, so color is white. Okay, that's actually a typical skin bacterial infection. Now, cellulitis. Cellulitis, in recent years, always on a national board exam. What is cellulitis? Cellulitis is a soft tissue inflammation. Soft tissue. What do you mean soft tissue? Well, it's under the skin. You have lots of connective tissue, right? So those tissues, soft tissue, gets inflamed. So reflect on the skin. Skin is red, like a patches. It's red, a little warm, a little burning sensation, but not very painful. Cellulitis. Okay, so this is called cellulitis. Subcutaneous, warmth, red, a little tender, burning sensations. Yeah, cellulitis. But then, if the cellulitis affect specific lymphatic vessel, tissue, you have lymphatic vessels, and then the infection spread through lymphatic vessels, so you may see the streaks of the lines, with the redness, right? And this is called erysipelas. So erysipelas is in a soft tissue, you have the lymphatic vessels affected. So this sometimes we call red toxin. Chinese they call what? Dandu, red toxin. Red toxin. Erysipelas. Erysipelas. So lymphatic vessel. So you can trace it, let's say from the leg, right? And it all the way up. Then the problem is you try to find out why you have cellulitis, why you have erysipelas, where the bacteria come from. Actually, bacteria is from a wound. Let's say a person has athlete's foot, tinea infection. And then that infection skin cracks, right? And then what? Bacteria get in. And then travel to the tissue, local tissue. And it gets either cellulitis or erysipelas. And a lot of times even mixed cellulitis, erysipelas combined. But it's all red. But remember, it's a subcutaneous, under the skin. It's not in the skin. It's below the skin, soft tissues. Okay? So that's a bacterial infection. Then pediculosis is the lice. Yeah, lice. It's usually in the hairy area, in the hair. Head lice, pubic lice, is that right? Yeah, so those are lice and it causes severe itching. Itching. So treatment of lice, pediculosis, very simple. Shaving. You shave the hair. And then the lice cannot hide because they live on those keratin. They dig the skin and get it from the hair, get it from the skin. So if you shave it, no place for them to stay, right? They die. And you can use some Chinese herbs, make a decoction and then wash it, the area, okay? Pediculosis is the lice. Scabies. Scabies is the mite. Another one, mite. Bites causing severe itching too. Scabies. Yeah, scabies. And urticaria. Urticaria is the hives. That's an allergy. Yeah, like suddenly skin gets red, patchy red, and very itching. Sometimes could be have some food, right? Or have something you contact and then get urticaria. Hives.
Because of food also?
Yeah, food allergy. Yeah, that's allergic reaction. Hives is allergic. TCM we call winged wheals. Winged because it spread quickly. Yeah, suddenly and then migrating to everywhere, right? So winged wheal. Yeah, wheal. It's called wheals. WHEAL, wheal. Winged wheal. That's what TCM we call that, right? Hives. Yeah, urticaria. Now, vitiligo. Either way you can say it. Vitiligo, loss of skin pigmentation. Skin pigment is lost. Pigment loss, then you see what? Skin patch white, right? So area you have no pigment, it shows a white color, right? Yeah, and that's called vitiligo. Either way, both are fine. I hear some doctors are vitiligo, some call vitiligo. What's the difference? Same thing. Yeah, same thing. But loss of skin pigmentation. You know what happened? Well, pigment is produced by the pigment producing cells, melanocytes, right? Melanin producing cells, autoimmune. Immune system attack those pigment producing cells, causing lack of pigment. So those cells are killed, then they cannot produce the pigment. That's what they get vitiligo. Okay, yeah, so this is autoimmune. See, that's why another autoimmune conditions. Okay, the alopecia, you know that, right? What's alopecia? Alopecia is a loss of hair. Loss of hair, especially in males, that related with the testosterone. So there's some genetic factors, genetic genes, yeah, and inherited, and it was the testosterone effect, and it causing hair loss. But in women, if there's alopecia, now you cannot use the hormone to explain. Because female, usually estrogen is not as strong as testosterone for hair growth. That's why for women, mostly is alopecia, maybe endocrine disease. Endocrine disease, it may affect the hair growth. So this is alopecia in women. For men, is testosterone. We know that. Yeah, it's a male pattern loss of hair, alopecia. Okay, so this is what we see. Skin, basically, as I said, it's just a definition, and then you know the manifestation, then that's it. Easily to recognize that. What exact skin problems you have, you will find out. Okay, I'm sorry. Then after that, the condition skin, we have it, right? So next one is, there's another one, skin cancer here. Yeah, on the other page. Skin cancer, we know that, right? Some cancers that grow very slow. They do not transfer, like a basal cell carcinoma, squamous cell carcinoma. Those are not a main worry. If you have a rash, actually, a lot of people have it, they don't even know. You have a little bump in the skin, right? And you know what's that? Until you do biopsy, you know that. But the ones you have to concern more is what? Malignant melanoma. This cancer is malignant. Even though all over, in terms of a skin cancer, it's only 4 or 5%, a maximum 5%. 100 skin cancer patient, only 5 of those will be melanoma. So it's not as common, but it's more deadly. Why more deadly? Because this cancer can quickly transfer, distant transfer, metastasize. That's why we have a way to skin most. Yeah, this is the anatomy physiology. We talk about that, right? We use the A, B, C, D, E rules. We reviewed that before, I think, right? A, B, E, C, D, E. A, if you see a mole, is asymmetrical, not even. B, the border if it's not regular. C is the color. If the color is mixed, blue, brown, black, red, mixed, not good. And then D is diameter. If a diameter is bigger than 1/4 of an inch, 1/4 of an inch, okay? And E is if it's raised, elevated, or actually it evolves. Let's say it gets enlarged, getting bigger, right? And then those are the signs may indicate this mole, you need to take care of it. So you go to see a dermatologist, they probably will do a biopsy, this mole, to see if it's a melanoma. Because if you don't take care of it, melanoma, then it could spread very quickly and it's deadly. Yeah. So malignant melanoma, even though it's not as common, but it is the most deadly skin cancer. And then you do need to use A, B, C, D, E, this method to skin. Asymmetrical, border irregular, mixed color, diameter bigger than 1/4 of an inch, and E is elevated, raised, or evolve. Evolve means used to be small, now it becomes big. It used to be flat, now it's erased. That's right. Now, before wasn't have any bleeding, now it has some bleeding. Evolve, that means have some changes. So A, B, C, D, E will help you understand, right, how to screen that for this melanoma. So those are all the skin. I think the time again, so we're going to take another break and then come back. We're going to move on. Next topic will be the gynecologic and obstetric memory conditions, okay? So we'll take another break here. Recording again so we can look at a lot of diseases actually. Oops. Okay, gynecologic, obstetric, and memory glands. Okay, so you can see. Well, infertility. Yeah, we know that infertility is not absolute sterility. You cannot have a baby at all. You just have a difficulty to get pregnant, right? And then if they ask you what is the most common cause of infertility, men, women, half and half actually. For men, we know that low sperm cell count. For women, most likely as well, and ovulation, no ovulation, no egg released. Okay, and most likely as well is related with the hormonal conditions. Yeah, like one of those always on the test. We have this one later. You're gonna see it's called 158 polycystic ovarian syndrome, PCOS. That's a heavily tested, always tested on a national board exam. PCOS, talking about PCOS, right? Infertility is the main thing, most common cause of infertility. PCOS, polycystic ovarian syndrome. What's wrong with that? Ovary has lots of cysts. So egg mature cannot be released. They stay in the follicle, so form a cyst. Okay, so they test you. How you diagnose? Well, diagnosis is ultrasound, and then you see that, right? The cyst. And then what's behind this? Well, we know that it's actually insulin resistance. There's insulin resistance. Insulin resistance, people say, oh, is that cause diabetes? Yeah, those people are at the risk for diabetes, type 2 diabetes. And the second is what? It causes excessive testosterone production. So a lot of male hormone, which antagonize the estrogen. Yeah, so that's why causing ovulation problem. Okay, and those people usually have excessive body hair growth, right? Like a mustache, beards, or sometimes chest hair for women. Yeah, and those and they usually overweight. Yeah, and then, but the biggest problem is ovulation. Yeah, no ovulation. Okay, so this is infertility. Then, infertility, you do follow the protocol, when you check, right? And the different hormones you have to check, and the ovulation status. Amenorrhea is no menstruation. Yeah, we know that, right? And just keep in mind, primary amenorrhea person never had a period. Secondary amenorrhea had a period before, but now no more period. That's called secondary. Okay, and amenorrhea, it has nothing to do with ovulation. A person can have ovulation but no menstruation, can have no ovulation but still have menstruation. This is all not exactly equal, not the same thing. Amenorrhea is no period. For example, we say a young skinny girl present to the clinic saying with amenorrhea, and when you look at a person extremely skinny, and you suspect what? Anorexia nervosa. Yeah, so that's the one, see, amenorrhea, right? But let's say a person has amenorrhea, no menstruation, because she's an athlete, running marathon. Well, then you know what? Hypothalamus, maybe the hormone suppressed. So that's why they don't have periods. Yeah, so athletes. Yeah. So there's many causes for amenorrhea, but you have to catch it is primary, secondary, the difference. Primary, it could be developmental issue. You never had a period. Secondary, you had it before. See, actually, there's a one question they were asking, what is the most common cause of secondary amenorrhea? You had a period before. All of a sudden, no period. Most common cause. A lot of people know that is pregnancy. If you're pregnant, of course, you don't have a period, right? Yeah, but this is kind of, something sometimes you can't think about too much, that could be a problem, right? And then dysmenorrhea is a painful menstruation. Painful. Now, painful menstruation, yeah, all women have menstrual cycle. They somehow have a little discomfort, some pain. Some can be tolerated. Some is not very, strong. Used to have a board exam question asking, what is the single most common cause for a childbearing age woman to miss school or to miss a job or absent from a job? Single most common cause for missing school or actually job absence is what? Is dysmenorrhea. Dysmenorrhea, painful menstrual cycle. Yeah, so this is basically dysmenorrhea. But if a person starting the period always have some pain, right? That's primary, which is nothing really serious. Usually the bad one is starting the period, beginning, don't have any pain. But all of a sudden, at one point, it start to have a pain. Like later on, during the, when you get older, so then what? Usually be careful, endometriosis. So endometriosis, what they have is called secondary dysmenorrhea. That's the main feature, endometriosis. Yeah, so uterine lining tissue going to the outside of the uterus. And every cycle, they have a bleeding, and it forms the scar tissue and then causing pain. Okay, so this is called endometriosis. Okay, so this is the one. Uterine lining tissue find outside the uterus, on the ovaries, on the fallopian tube, or on the pelvic cavity, within the pelvic cavity. Okay, so this is endometriosis. Now, the DUB, dysfunctional uterine bleeding, is just the uterus bleeding beyond the menstrual cycle. So no menstrual blood, but just the in between the two periods and then some irregular bleeding. That's called dysfunctional. Dysfunctional means what? Means there's a dysfunctioning hormone imbalance. That's why it can cause some bleeding in between. So it's totally a functional condition. It's not something structural. You have a bleeding, right? Structural. So this is the dysfunctional, DUB. Okay. Fibromyalgia, we call the one, fibroids. Fibroids are the smooth muscle tumor of the uterus, which is the most common benign tumor in women. Women, most common benign tumor. It's not cancer, benign in women. Okay. And the uterine smooth muscle overgrowth tumor. Yeah, that can increase the what? The amount of menstrual flow, a heavy period, or sometimes what? Because of enlargement, like early pregnancy, then it can have a pressure. So got a frequent urination, constipation. Is that right? Yeah, sometimes it can get really big. Yeah, so this is the fibroids. But if you detect it, or you surgically remove those fibroids, yeah, it should be okay. Yeah, okay. So fibroids is benign, smooth muscle tumor. Okay, in the uterus. They're the most common female tumor. And then it's related with estrogen. Yeah, sometimes just the estrogen stimulate the smooth muscle tissue overgrowth. Okay. Now, PID, pelvic inflammatory disease. This is actually what is the pelvic reproductive system organs gets inflammation, and it typically is caused by infection. Yeah, mostly is what? Chlamydia and gonorrhea. Gonorrhea, sexually transmitted infections. And that can cause what? Pelvic inflammatory disease, inflammation, and pelvic pain. Well, chronically, sometimes because of a tissue gets a scar tissue after healed, right? And then twisted fallopian tube affect the transport of the egg and the sperm. So a person may can have a fertility, also infertility. Okay, so PID. So it's infection, STI induced. Ectopic pregnancy, pregnancy occurring outside the uterus. Most common site, fallopian tube. And the biggest risk is fallopian tube does not have enough space for the baby to grow. So it can easily rupture and causing massive bleeding. Ectopic pregnancy. It could be a medical emergency, right? If it's a bleeding, suddenly, rupture. Okay, ectopic. Those are actually, by definition, you can tell, very easy. And then PCOS, that's what I said. Many board exam question, PCOS. This one, definitely you have to focus on that. Most common endocrine disease in women. Most common cause of infertility in women. Insulin resistance is the real root cause. And then excessive testosterone, responsible for symptoms. And then no ovulation, related to infertility. Yeah, that's all we have, right? Yeah, so this PCOS and ultrasound help you diagnose the problem. Ultrasound, right? Yeah. If you add a treatment, how do you treat those? Actually, treating is using ovulation-inducing agents. Try to use drugs to promote ovulation. If they can ovulate, yeah, things get a little better. Yeah, because they have infertility, right? So if they can ovulate, possibly can get pregnant. Usually sometimes after a pregnancy, the condition may be improved a little bit. Okay, yeah, so PCOS. Premenstrual syndrome, yeah, PMS, we all know that. People say don't mess up with a woman, has PMS, because PMS has a lot of physical, mental, emotional, social, all kinds of those changes. Has been described. There are more than 200 different PMS symptoms, more than 200, all kinds. Yeah, so that's why sometimes emotional, sometimes it could be the physical discomfort. Yeah, so this is PMS. It's all related with the hormonal changes. Yeah, some changes with the hormone. So this is the cause of the PMS symptoms. Okay, yeah, but after the menstrual cycle, symptoms can usually easily resolve, or improve, right? So this is the hormone related. Perimenopausal syndrome. So around the menopause, then you also have some set of symptoms. Yeah, first irregular periods, menstrual periods become irregular, and then you have lots of physical symptoms like hot flashes. Is that right? Yeah, and even some emotional changes, mood swings. Sometimes up and down. Is that right? Hot flashes, feel hot, like indeficiency signs. Yeah, perimenopausal. Yes, around the menopause age. Okay, 45 to 55. Menopause. Transition, 10 years. Okay, postmenopausal. Okay, so around menopause. And then, now we talked about one earlier, right? It reminds me always, every time I talk about menopause. Postmenopausal. After menopause. The biggest, single most important health hazard you need to watch is what? Is osteoporosis. Okay, for woman, osteoporosis. And then during pregnancy, you have a condition called pregnancy-induced hypertension, high blood pressure, either preeclampsia or eclampsia. What's the difference? Eclampsia is a seizure. Yeah, so a pregnant woman, because of high blood pressure and causing seizures. A pre means what? No seizure yet, but it can turn into seizure. But how can I tell this person has no seizure? It's preeclampsia. So typically is if you find proteins in the urine. That's what the question they ask. A pregnant woman has a pregnancy-induced hypertension. Now proteins are detected in the urine. Okay, so this patient is what? Is having what? Preeclampsia.
What's the relationship?
Huh? Well, that means hypertension condition caused the kidney damage and the protein lost, right, in the urine. And in this stage, you think about what? It may trigger what? The seizure. It's kind of relationship. But if no proteins in the urine, you don't have this risk. If you have this, then likely what? You will have a seizure. Then the treatment is actually, well, I don't think they test the treatment. What is the best treatment for preeclampsia or for eclampsia? Already have a seizure. What's obvious, right? Is what? Termination of pregnancy. So if the baby is born, then that's it. Everything is over. Termination of pregnancy. Sometimes preeclampsia, pregnant woman, if the baby is a mature term, doctors will do the elective C-section. Yeah, try to get the baby out as soon as possible and then prevent the seizure. Because when you have a seizure, mother could die, the baby could die also, is that right? Yeah, it's very serious. Okay, so you have to prevent. It's actually what? It's a high blood pressure. But this high blood pressure is pregnancy induced. You know, when you have a pregnancy, during pregnancy, hormone, electrolyte, body fluids, it's all changed, right? Yeah. That's what easily what causing this high blood pressure. This is the one, okay?
So what is the relationship with protein
okay.
issue and seizure?
Seizure, okay. Just corresponding. If the kidney is damaged to this level, right, have proteins in the urine, right, that tells you your brain probably also damaged. But brain damage, the sign is what? Is the seizure. So you know what I'm talking about? So that means the pregnancy-induced hypertension, if it causes complication, neural, nephro, kidney, it's all similar at the same time. So, but the protein in the urine, we can detect it. The brain, we cannot even detect it. Is that right? But if the protein you find in the urine, that tells you probably going to have a seizure very soon. Yeah. That's why usually at this stage, they would try to stop pregnancy. Hopefully the baby is already mature. And then you do a C-section. Yeah, deliver the baby as soon as possible. Okay, so that's what the kind of a logic behind this. You judge it by something that is detectable, right? And to predict something is going to happen. Okay, so this is the one. And then spontaneous abortion, miscarriage. Yeah, miscarriage was just well, when you say miscarriage, how big, how many months of a baby during the pregnancy is called abortion. Otherwise, you cannot even call abortion. It's typically 20 weeks, before 20 weeks. So before 20 weeks pregnancy, baby is miscarried, aborted, that's abortion, miscarriage. Over 20 weeks, then what? You cannot call abortion anymore. Is what? Premature birth. Yeah, premature birth. Yeah. So that's what the difference you see there. Okay. When you see miscarriage, has to be before 20 weeks. Now, what is a normal pregnancy period? 40 weeks. It's like halfway. Yeah, halfway. If you reach halfway, then you cannot call abortion anymore. Okay.
Which means after 20 weeks, even the baby is born at 20 weeks,
yeah,
they still consider this is survivable.
It survive. Yes, yeah, it could survive. After 20 weeks, they can survive. Yeah, possible. Yeah. So that's why abortion is before that. Well, abortion could be still alive, baby, you know. Like a large month, you know what? A baby, I've seen one is 16 months, the baby is aborted and the baby's still alive, you know. But you usually don't keep them, you know, because lots of organs are not well formed yet. Yeah. Okay. Yeah. So this is the one. Miscarriage, but that's the definition, we know that. And then vaginitis. That's actually a common female reproductive conditions. Yeah, inflammation of vagina, bacteria, fungus, protozoa, they all can cause that. And mainly diagnosis based on the discharge. Yeah, the discharge, and they send to the lab. And then usually just remember, anytime you try to diagnose vaginitis, at the same time, you always want to do pap smear. You check the cervix, yeah, pap smear, to see any cellular changes too. Okay, yeah. So the vaginal discharge is used to diagnose a specific type of vaginitis. Okay, yeah, so this is the one. Cervical cancer. Yeah, pap smear is screening. Starting age 20, a girl start to have a sexual life every year. Have a pap smear. Okay, and then this is what's the risk, right? And then virus associated with cervical cancer, you have to know HPV, right? And we do have a vaccine, right, for HPV vaccine. Yeah, this is the one, you know that. And then most presenting symptom for cervical cancer is what? Is post-coital bleeding. So after sexual activity, post-coital bleeding. So after sexual intercourse has bleeding. So it's called contact bleeding, contact. Then you be careful, could be the cervical condition. Yeah, but pap smear, you check the cells. If pap smear is abnormal, you have to do endoscopic examination with biopsy, which is called what? Colposcopy. Colposcopy is endoscope. Then grab the tissue and then send for the lab. So biopsy, confirm if it's a cancer or not. Okay, but before you do colposcopy, you do pap smear first. Okay, pap smear first. So this cervical cancer. Now, endometrial cancer occurs late. It's in women after menopause. A woman 60 years old. Menopause occurs 10 years ago, but now suddenly have some bleeding, even though very small amount. Okay, and then you suspect maybe postmenopausal endometrial carcinoma. How do you confirm? Endoscope. What endoscope is a hysteroscopy. Endoscope inserted into the uterus and then scrape some tissue and then send to the lab, the biopsy, and then confirm if it's an endometrial cancer. So endometrial cancer typically is a patient with the post-menopausal bleeding after menopause. So menopause is supposedly normal bleeding, right? But all of a sudden has bleeding again. Then you need to do hysteroscopy, do biopsy, and then confirm if it's a cancer or not. Okay? So this is something like critical things is this. Yeah. Endometrial cancer. Okay? So endometrial cancer is usually not young people, have old people usually, after menopause. Okay. Ovarian cancer, is the most deadly gynecological cancer, and cancer growing in the ovaries, and it usually detected very late. People don't even know until they find out abdomen has a fluid or the tumor growing so big, and it make the abdominal girth increase. Like abdomen is so big now getting, and the people were thinking you gain some weight, but actually no. Ultrasound, you detect it. There's something growing on the ovary, and it is the deadly one. Yeah, ovarian cancer, because a lot of times they detect it at the late stage, ovarian cancer. And there's no particular screening for ovarian cancer. No screening. So that's why sometimes it's hard to detect early, So, okay. So ovarian cancer. Yeah, why it's dead? Because it transfer. It goes everywhere, So it's not just staying in the local area, okay? Then the next one, mastitis. Mastitis is what? Is inflammation of the breast. Inflammation of breast. Yeah, and a lot of time is when a mother is breastfeeding the baby, lactating. The baby's mouth has some bacteria. And the mother's breast, the nipple, sometimes little cracks, and the baby's mouth bacteria enter through the cracked area, and they were entering the duct and causing inflammation. So the treatment is actually what? Keep feeding the baby. Keep feeding the baby with mastitis. Why? Because anyway, the bacteria comes from baby. So the breast milk coming out, it's actually good. Keep the milk flow more smoothly. Yeah, well, actually what? Push the things out. Don't let them get inside. So, unless the breast has abscess, pus formation, then you don't want to feed the baby because the pus has bacteria and then you go to the baby, that could be a problem. Otherwise, without the pus, just mastitis, just keep feeding the baby. Just make sure the milk is coming out all the time. Okay, and in the bacteria is staphylococcus, staph, from baby's mouth. Okay, mastitis. Breast cancer. Now, breast fibroadenoma, which is the benign tumor. It's like if a person finds a lump and the biopsy showing it's not a cancer, it's the adenoma. So adenoma, the gland, what tumor. Usually it goes with the cycle, menstrual cycle. So before the menstruation, breast distension, and then you may find out the lump. But then after the menstrual cycle, and the lump will kind of shrinking, and then no more pain. Yeah. This is a fibroadenoma, a benign tumor, benign. Okay, and nothing really you need to be concerned. And the only thing is you just have to follow up, watch closely to see if there's any changes. Okay, so that's benign. Now the breast cancer, this is malignant breast cancer. So breast cancer, they do have questions. Ask that. First, what is the most common presenting symptom of a breast cancer patient? It's accidental finding of a lump. Accidentally, they find out the breast area has a lump. And they go to see a doctor, biopsy, confirm breast cancer. Okay, that's the most common. But we do have a screening. Woman self-examination starting at age 20. Monthly self-breast examination every month until age 40. Then you need to go to see a doctor, healthcare professionals check for you. At the same time, you need to have a baseline mammogram, X-ray, to see if there's any hidden little mass. And typically is you do once a year. But even though the standard these days, if a woman does not have a family history, does not have any lump, never find any lump, so when you have a 2 or 3 mammogram normal, then doctors maybe say, okay, I'm going to do it 5 years later. That's okay. But otherwise, on the safe side, you should do every year, annually, mammogram. And plus the physical examination of the breast annually, every year, by the healthcare professional. But you continue to do yourself monthly, every month, self-check of the breast, okay? For early detection, breast cancer, okay? This is one. So then after that, we look at some sensory organs. Conjunctivitis, just pink eyes. Mostly it's a virus infection. But pink eye does not affect the vision, just excessive tearing, itchy eyes, and a foreign object feeling in the eyes. That's it. Keratitis. Keratitis is inflammation of what? Of cornea. Which is the clear membrane that you put a contact lens. So this is called keratitis. Sometimes it is contact lens caused. But good thing is the cornea has a very strong self-healing, regenerating property. So if contact lens you wear feels kind of not comfortable, you take it out, maybe keratitis, you wait a few days, and everything is good. Self-repair. That's a cornea. Keratitis, use different names. Myopia, hyperopia, that's easy, right? Nearsightedness, farsightedness. It's just a term. Nearsightedness can only see close things. Distant cannot see. Farsightedness can see the distant object. Close vision is not good. Okay? And we said earlier, right? Presbyopia is what? Elderly vision. Close, distant, both are not good. So you have to wear what? Bifocal. Bifocal lenses. For distant, for the local, both. Okay? Astigmatism. Astigmatism is the eyeball surface. Cornea lens is not very smooth, even. It's kind of a little distorted. So that's why when you see something, light rays pass through and it causing what? Irregular image. That's called astigmatism. Astigmatism because of a reflection going through an unsmooth surface, right? That's why created image on the retina is different. This is called astigmatism. Okay, light being spread in the different angles. Okay, astigmatism. Cataract. Cataract is the lens becomes cloudy of lens. So then, when it's mature, fully mature cataract can be surgically removed and then replaced with the artificial lens. So cataract. So cataract is not permanent. It's just the kind of you can replace it, and it's not going to affect the vision. But the glaucoma is a permanent one because glaucoma is increased eyeball pressure inside, too much fluid, and then pushes back eyeball and causing the optic nerve receptors damage, so you can go blind. Glaucoma is more urgent; it needs to be treated than the cataract. Cataract just blur the vision. After you replace the lens, everything's okay. But glaucoma is you have too much fluid, either overproduction or block the drainage. So you can use surgery too. Yeah, I try to correct it and reduce the fluid volume. Okay, glaucoma. Now, diabetes, hypertensive, retinopathy. Yeah, just like they can cause nerve damage, causing kidney damage. Here's what they can cause retina, photoreceptors area damage. That's why prolonged. If a person the condition is not corrected, and you can have retinopathy, affected vision. Yeah, so blurred vision and eventually blindness. Macular degeneration. Macula is an area supposed to be responsible for sharpest vision because it has most photoreceptors in the back of the eyeball. But degenerated, so that's why older people, when you look at things, nothing is sharp, so yeah, always a little blurred. That's because of a macular degeneration. Okay, macular degeneration, that area. Retinal detachment. So retina is detached from the bottom tissue. The bottom have blood vessels that nourish the retina. If the retina detached, no nourishment, and then those neuroreceptors, photoreceptors will be there, and it quickly will become what? Blind. Yeah, retinal detachment. So you have to do surgery, retachment. Attach back. Usually use the laser treatment, okay? Retina retachment. Then allergic rhinitis, which is we call what? Hay fever. Allergy induced to what? Runny nose, itchy nose, allergic, hay fever. Okay. So this is, we know that, right? Any kind of allergic agent cause that. Sinusitis, sinus inflammation. And the sinus inflammation comes from where? From the nose. Because sinuses are associated with the nose, connected with the nose. So nasal infection can spread to the what? To the sinus. Sinusitis was the nasal infections. That's associated. Strep throat, we just talked about that. Streptococcal pharyngitis. If it's a locally, you treat it, antibiotics, bacteria, control it, fine. But the problem we're concerned is the post-streptococcal. When they're fighting, then they may travel. There's a fighting complex, antigen antibody complement, may travel to another organ, staying there, and it causing post-streptococcal complication, like the glomerulonephritis, kidney. A typical case is this. This kid has a history. 2 weeks ago, has some sore throat, and then what? And some fever. Now, 2 weeks later, his urine has blood in there. Also, the body gets swollen, like the leg. Oh, you go to see a doctor, and they tell you is what? Is the post-streptococcal glomerulonephritis kidney. Yeah, so that's what you're concerned. Strep throat. Okay, so strep throat, just local is okay. Antibiotics can control, but if it becomes what? A systemic complication, that could be a problem. Otitis media, middle ear infection. Why middle ear is more likely get infected than external ear and inner ear? Well, inner ear is a closed system, so nothing can get in easily. And the external ear is open system. It can go to the outside environment, right? And you have ear wax. It can help you catch those bad stuff. But middle ear, you know what? It's a chamber where actually has a tube going all the way to your throat. And that tube is called eustachian tube. Yeah, anatomy review, you can see that. Eustachian tube. So eustachian tube connects the middle ear to your throat. So anytime you have a throat infection, then what? Possibly can spread to the middle ear. And especially in babies. Why? Babies' eustachian tube is very short. Yeah, so baby get a sore throat infections, and easily what? Causing middle ear infection. Otitis media. Okay, so middle ear infection. Tinnitus, just the ringing in the ear, ringing, yeah, which is hallucination. That means you don't have actually anything stimulation, but you do feel the ear has a ringing. Yeah, so that's why usually we say, well, patient that has some 3 symptoms: tinnitus, vertigo, and hearing impairment. That's what Meniere syndrome, right? That's why number 186. Meniere syndrome, 3 things: tinnitus, ringing in the ear, vertigo, feels like spinning, and hearing impairment. But this hearing is not permanent. It's more like a fluctuating. At one point during attack, hearing reduced, but no attack, everything's okay. Okay. Tinnitus, vertigo, and what? Conductive sensory neural deafness. Yeah, so when you have a hearing impairment, deafness, either a conduction problem, for example, if you have excessive earwax blocking the ear canal, or eardrum rupture, or ear bones fracture, well, that's going to affect the what? The conduction, right? Sound conduction. So that's called conductive deafness. But sometimes conduction is good inside the ear, in the ear, receptors, or the nerves that send to the brain, and it has injury. Then what? Sensory neural deafness. So sensory neural is talking about the receptors, the nerves, even sometimes the brain. Somebody got a stroke in the temporal area where you have what? The hearing center, right? If you got a stroke, then what? Your hearing suddenly what? Lost. Okay, but that's called sensory neural deafness. So one is more outside, conduction. Okay, Meniere's 3 features. You have to know that. On the test, they may not ask you what are the characteristics of Meniere syndrome. You all remember, right? Definitely the tinnitus, vertigo, and impaired hearing or deafness. That's so easy. You know what they do? They give you a case. This 65-year-old woman, comes to see you, and with episodes of almost falling because it feels like the house is rotating, spinning, right? And when you check do the hearing test, and you find out, yeah, hearing is kind of reduced, or maybe one is reduced, the other one is okay. And also, once in a while, the person feels there's some metallic sounds in the ear, like a metals, but there's really no stimulation and things like that. Then they ask you, based on those descriptions, what do you think is the most likely diagnosis? So if you're quick enough to know those 3 features together, you diagnose with what? Meniere syndrome. Meniere, yeah. So this is, and even sometimes the loss of balance, even, right? Because when you have a vertigo, okay. Then after that, you have what? Some nutritional. Yeah, that's actually a pretty easy one, straightforward. If a person has a vitamin A deficiency, what do you have? Nyctalopia, night blindness. Nyctalopia is a night blindness. You don't have a vision at night. You cannot see. Because vitamin A is required for making a pigment for your night vision. Beriberi. Beriberi is a vitamin B deficiency. B1, which is called thiamine. But what's beriberi? You'll say beriberi, you have 2 types, dry and wet. Dry is a nerve, so affect the nerve. So nerve function affected. Wet is the swelling, which is the heart. So when the heart failed, then that's going to cause a fluid retention, right? Because blood circulation is affected. Then you have a swelling. But so it's either dry or wet. Wet is the heart. Dry is the nerve. Yeah, so B1 deficiency, thiamine. B3 deficiency is called pellagra. Pellagra. What's pellagra? Pellagra, if you can remember, 3D symptoms. If you don't have vitamin B3, niacin, you have 3 manifestations. Seems like not quite related. First, on the skin, it gets dermatitis. Skin, dermatitis. Okay? And then another D, second D is what? It could affect the mental, dementia. Okay? Yeah, so if you have a D3 deficiency, dermatitis, dementia, another one is affect what? Sometimes affect digestive. Easy to get about diarrhea. Yeah, D. So anything with a D, lots of D symptoms, yeah. Diarrhea, dermatitis, dementia. Oh, we think about B3 deficiency. Okay? And that's called pellagra. Pellagra. In some books, they put more. The most severe D, what D? Death. I could die. If you have a severe B3 deficiency, yeah, that can cause more problem, okay? Then after that, B12. B12 deficiency, they do ask a lot of questions. You know why? First of all, you have to know B12 is very unique. Mostly B12 is found in the food, animal products. Very limited in the plants. So if a person is strict vegetarian, vegan, likely to have a B12 deficiency, okay? Second, B12, even though you have lots of B12 in your diet, But B12 absorption is actually what? You need a factor that is coming from the stomach called intrinsic factor. Intrinsic factor, IF. Without this factor, you cannot absorb B12. So stomach problem can affect the B12 absorption. Intrinsic factor. And the B12 absorption is where? It's actually in the last part of the small intestine, which is called ileum. Ileum is absorption. So when somebody has ileum problem, like IBD, inflammatory bowel disease, right? Crohn's disease, their ileum area is damaged, ulcers, their B12 will be what? Absorption will be affected. So multiple factors, dietary source, the factor that affect absorption, and then the absorption site, they all can cause what? B12 deficiency. A B12 deficiency causing anemia, and then those anemia features very important. It's a big cell, dark color. So cell is big, color is dark. And also what? They can affect peripheral nerves, B12 deficiency. Affect peripheral nerves, which is different from the folic acid deficiency. Folic acid deficiency also causing big cell anemia, but usually not affect the peripheral nerves. If you see a person has a nerve symptom, then it's anemia, macrocytic anemia. Macro is a big cell, right? Macrocytic anemia. Then if you have a nerve symptom, and you think it's what? B12. If no nerve symptom, folic acid. Yes, that's why, okay? And then B12 deficiency anemia is what we call, especially with the stomach problem, causing that is called pernicious anemia. Pernicious. Pernicious means what? It's here. Pernicious, number 190. I mean, it's really bad. Pernicious. Malignant. Another malignant, Yeah, anemia. Scurvy, we know that, right? Vitamin C deficiency, scurvy. Yeah, vitamin C is required for making the collagen fibers. If you don't have collagen fibers, the body supporting structures is weak. So that's why scurvy, a person easy to get a gum while bleeding, right? Your gum supposed to need lots of what? Collagen fibers. And then you don't have enough fibers, easily what? Get a bleeding. Okay. Rickets in children, osteomalacia in adults is vitamin D deficiency. Children probably is a lack of sunlight, lack of a dietary supply of vitamin D. Adults, osteomalacia is because of a fatty diarrhea. Fatty diarrhea, which is called steatorrhea. Steatorrhea. Lose lots of fat. And don't forget, vitamin D is a fat soluble. If you lose fat, you cannot absorb vitamin D. So you don't have enough fat, right? So fat soluble. And then causing what? Calcium absorption affected. Because vitamin D is required for calcium absorption. Yeah, so that's how people get what? Osteomalacia. So in adults. Children is called rickets. Okay. Vitamin K deficiency, we know that is what? Well, that causes what? Bleeding. Because vitamin K is required for making clotting factors in the liver. So without vitamin K, then you cannot what? Make those clotting factors. Okay. Yeah, sometimes we do on purpose inhibit vitamin K. Is what? Anticoagulant. Yeah, anticoagulant warfarin is a vitamin K antagonist. Why you do that? Because you don't want to make lots of clotting factors. So to what? Anticoagulant, prevent what? Clotting. Common question for vitamin K on national board. What is the endogenous sources of vitamin K? Like inside your body, where you get a vitamin K? From your body, actually. Your body will have vitamin K. Although food has vitamin K, but your body actually, intestinal bacteria provide you a lot of what? Vitamin K. That's the advantage. So intestinal bacteria provides the internal source of vitamin K. So don't forget that, okay? So vitamin K deficiency. Then the last part, genetic. Hemophilia, that's a lack of clotting factor that causes bleeding. Hemophilia, is right? Like to bleed, yeah. That's a genetic. And then color blindness, same thing, genetic. You know what? Hemophilia, color blindness, even the next one, Duchenne muscular dystrophy. So muscle development is a fact. Those three genetic disease, they all have the same what? Genetic pattern. Those three. It's all what? X chromosome linked, X-linked, recessive disease. So usually, the mother is a carrier as X chromosome, carry this abnormal gene. Father is totally normal. Then when they have a baby who is a son, because the son get X from mother, get a Y from father, right? Father has a Y, nothing. But mother gives a wrong X, so the baby has a disease. So it's X-linked recessive genetic disease. Yeah, recessive means hidden. Because the mother may be normal, it's just a carrier, right? But because only one gene, mother, father is Y. Y has nothing to do with that. So that's why if you get a one from mother, and you get it. So typical pattern is the mother transmitted to what? To the son. Okay. Cystic fibrosis, that's different. Cystic fibrosis affect glands, like a mucus gland in respiratory, easy to get a pneumonia, and affect pancreatic gland, affect enzyme secretion. So that's the most typical, either respiratory infection or pancreatic affect digestion, because not enough what? Enzymes being released from the gland. But we'll also do the skin test for diagnosis, cystic fibrosis, because of what? Skin sweat glands has a lot of salt. So high salt content detected in CF, cystic fibrosis, which is used for diagnosis purpose. Diagnosis. Sickle cell anemia. That's a red blood cell. Hemoglobin is wrong. Yeah, sickle cell. They cannot carry oxygen. Cell is sickle shape and also easily cause obstruction. It block the vessel and then causing the pain. Yeah, so sickle cell disease. That's also genetic. Down syndrome, you know that, right? Is one of the chromosome has 3 copies. And that's going to affect what? The mental developmental retardation, Down syndrome. Yeah, maternal age after 35 greatly increase the risk. And then Turner's and Klinefelter. Turner's is what? 45 chromosome XO. So missing one X chromosome, Turner's. And the Klinefelter's is a boy, 47 chromosome with an extra X chromosome. Yeah, see, that's the one. You can tell, genetic abnormality. Turner's 45 XO, girls, missing one X. Klinefelter 47 XXY, got a one extra X chromosome. And both of those are sterile because their sex glands are not well developed. And it was a mild mental retardation, mild. It's not severe. Down syndrome is more severe. Yeah, but those are mild genetic. But I think mainly we have to know is chromosome, which one is missing. Yeah, Turner's missing 45. And then Klinefelter missing, having an extra X chromosome. Okay, so that would be those 200 pathophysiology based on the exam content, the board, right? So next week, get ready. I'll give you a simulating exam, 100 questions, 2 hours. Okay, and after the exam, I will explain to you quickly those questions. Okay, thank you.